Good afternoon, everyone. Good afternoon, everyone. There we go. Eventually it works. Good afternoon, everyone. Welcome to the 25th meeting of the Board of Health for this term of Council. Welcome to the members of the board and to other members of Council in attendance today and to members of the public. You are always welcome here to these meetings. For those in the room with us, the screen at the back provides real-time updates concerning where we are in the agenda and what is coming up next if you need to refer to it. And you can also follow the agenda, especially not today because you're here, obviously, if you are here. And you can follow, but you can follow the debate because this is all televised on your computer, tablet, or smartphone at www.toronto.ca/council. And believe it or not, sometimes when I've been away, even in distant lands, I turn it on to see what's happening at committee or the board or at council. So the Board of Health gratefully acknowledges it is meeting on the traditional territory of the Mississaugas of the New Credit First Nation, the Haudenosaunee and Huron-Wendat, and home to many diverse Indigenous people. So we'll go through the agenda. Sorry, actually, first I'm going to ask, are there any declarations of interest pursuant to the Municipal Conflict of Interest Act? Seeing none, then we'll do confirmation of minutes from January 22nd, 2018, moved by Angela Johnson. Any debate on them? All in favor, opposed, if any, that's carried. So we'll go through the agenda in quicker order and then return to the ones where the items are held for one reason or another. The first item is 25.1, 2017, a year in review. The Medical Officer of Health has some comments she would like to make, and so I'll hold it for that purpose. 25.2, protecting and promoting the health of Ontarians, modernizing Ontario public health standards. Anyone to hold that? Seeing none, I think it's really to receive, isn't it? Yes. Yes, all in favor of receipt, opposed if any, that's carried. Moved by Councillor Shan. 25.3, increasing access to cooling in the community. There is a presentation there, so we'll hold it for that purpose. Look forward to it. 25.4, health and safety impacts of reimagining Yonge Street, Sheppard to Finch. The motion here is to, well, there's the motion there is in front of you. Moved by Trustee Glover. All in favor, opposed if any, that's carried. 25.5, appointment of Councillor member to the 2018 Toronto Urban Health Fund Review Panel. What we were looking for, you may remember, is a councillor. The rules of that panel is that it has to be a councillor, a member of council to sit on it. And so we need someone for till the end of this term at the end of November. And Councillor Kristen Wong Tam has kindly offered, if you're viewing, thank you, Councillor Wong Tam. So the motion is that the Board of Health appoint Councillor Kristen Wong Tam as City Council's member on the 2018 Toronto Urban Health Fund Review Panel for the term ending at the end of November this year. Unless there's another councillor that wants to take it on. Councillor Doucette's not saying anything. Okay, so all in favor of that motion, opposed if any? As she always is. All in favor, carried, seeing no opposition. Now we do have a request to add an item from Trustee Glover, and we'll need a motion for that. Moved by Councillor Glover. It's before you in pink. At this point, we're not debating it. We're just inviting that it be introduced and on the agenda. All in favor of that? Opposed, if any? That's carried. Okay, so what that means is that that's the item number 6, I think it is, 25.6. And it also means that we now have a speakers list, and all the people who've signed up to speak, you're officially on the speakers list. Before that, you were kind of unofficially on. I know it doesn't matter to you folks, but it does matter to the good, orderly running of this committee. Okay, so we have 3 items then. We have 25.1, 25.3, and 25.6, and we'll deal with them in this order. So 25.1 is 2017, a year in review. Dr. Davila.
Thank you very much, Mr. Chair, and good afternoon to the members of the Board of Health and to those of us who are joining us, members of the public and other guests here at the Board of Health. I'm very pleased to submit Toronto Public Health's first ever year in review report. And what can I say? But it has been quite the year, for me in particular, with many, many firsts. 2017 was my first year as the medical officer of health for this great city. 2017 also brought cutting-edge harm reduction services to life with the establishment of the city's first supervised injection service located at the Works at Toronto Public Health. We also delivered the first ever overdose action plan for the city and the first of such plans in the province. And we developed a real-time overdose surveillance and monitoring system, the Toronto Overdose Information System. We also initiated and participated in innovative dialogue related to drug policy, housing, homelessness, and mental health, and strengthened our public health relationships across the city and with our partners in the health, education, and social sectors. As you can see through the report that's in front of you in the agenda package today, while these efforts were underway at the city and in communities across Toronto, we were also actively engaged in the Ontario government's public health modernization agenda, including such things as participating in the review and consultation process for the revised Ontario Public Health Standards, the accountability framework and its operational requirements, submitting formal responses to proposed legislative and regulatory changes, advocating the need to clarify the relationship between medical officers of health and local health integration network CEOs across the province, and undertaking a comprehensive review and assessment of the Minister's Expert Panel on Public Health report and preparing a formal response to the Minister. In addition to these large and complex initiatives, we also successfully delivered on our day-to-day business by responding to more than 43,400 cases and contacts of reportable diseases, managing 426 outbreaks, completing more than 28,800 food premises inspections, and investigating more than 2,700 animal-to-human bite incidents. Toronto Public Health staff also completed 100% of the mandatory annual tobacco vendor display and promotion inspections, reached over 25,300 children, youth, and post-secondary students on prevention of substance misuse and mental health promotion, completed approximately 68,000 screens to identify individuals at risk for adverse birth outcomes and adverse child development outcomes, and more than 31,000 clients across the city received dental treatment at our Toronto Public Health dental clinics. And these are just the highlights of some of our successes in 2017. Truly, there are many, many more, and we should all be proud of what we have achieved together as Toronto Public Health staff, as a division, and of course, you as the Board of Health. I feel it important to also acknowledge how our success of this past year shapes our priorities for 2018 and where we go from here. Specifically, Toronto Public Health has committed to building our relationship across the city, our relationships, I should say, across the city, and will focus attention on collaborating with city staff, with councillors, and with community partners on such important issues as housing, homelessness, food and nutrition, health equity, drug policy, harm reduction services and strategies, healthy public policy, and evidence-informed decision-making. This last one, evidence-informed decision-making, is extremely important to our work. And through this, we are committed to developing a health status report and an ongoing reporting framework that will cover topics including child health and development, chronic disease and injury prevention throughout the lifespan, mental health and substance use, communicable disease and vaccination, and oral and dental health, and environmental health. The upcoming report will provide important data that will inform policy and program priorities, service planning and strategic direction for Toronto Public Health in 2018. It will also inform our key partnerships and citywide strategies, such as the anti-Black racism strategy, the poverty reduction strategy, seniors strategy, the 1- and 5-year plans for the Downtown East, and the Toronto Indigenous Health Strategy. We can expect this comprehensive health status report in the coming months, and until then, there are 2 very important data reports recently launched that will help inform and support our evidence-informed approach to public health, both now and throughout the coming years. The first report, released on the 28th of February, is the Toronto Foundation's 2017-2018 Toronto Vital Signs Report. This report presents a snapshot of the city's quality of life and uses an equity lens to highlight disparities and underscore how health and other dimensions related to quality of life vary across the population. Just to give you a sense of the highlights of that report, generally speaking, the data in the report show that Toronto is a relatively healthy city and shows that we have slightly better health outcomes when compared with provincial averages, including in such areas as life expectancy, overweight and obesity rates, physical activity, lung cancer, and breast cancer incidence, just to name a few. However, the report highlights some key areas that we need to work on. For example, residents in the lowest 20% income group have a significantly higher mortality rate when we compare that with the highest 20% income group. In fact, for every 100,000 people, when we look at the difference between these groups, you get 63 additional deaths in that lowest income group. Infant mortality rates are equally, showing this kind of disparity that needs addressing. These are important to our work in chronic disease prevention, in healthy public policy, and child health and development, and shows that we have much work to do, not only as Toronto Public Health, but along with our city partners. The second and very timely report is the Our Health Counts Toronto report, which was also released on February 28th. This report compiles 4 years of research and data on Toronto's urban Indigenous communities, and the data and the findings are quite remarkable. I'll just take a few moments to share some of these points with you, and I think you'll be struck in the same way that I was when I heard the results. First, through the Our Health Counts Toronto, we find that Toronto's Indigenous population is approximately 2 to 4 times more than what Statistics Canada reports through their census data. And I think that tells us something about the nature of reporting. Very sadly and very distressingly to me, over 90% of Toronto's Indigenous population lives below the before-tax low-income cutoff. Over 90%. I'm just going to let that sit with you for a while, because in fact it really struck me. And I think we have to recognize that this is a major and important inequity related to the social determinants of health. Over 1 in 3, or roughly 35%, of Indigenous adults in Toronto indicate that they are precariously housed or were experiencing homelessness during the survey. 1 in 3. 65% of Indigenous adults in Toronto reporting having one or more chronic condition. 15% of Indigenous adults in Toronto were diagnosed with diabetes by their healthcare provider. This is close to double the rate of 8% for the general population. I mean, the list goes on and on. And I think if I can, I won't give you the entire list. There is actually quite a bit of data generated through the Our Health Counts Toronto. But I would like to just share with you one more. 71% of Indigenous adults reported experiencing racism from healthcare professionals, which prevented, stopped, or delayed them from returning to health services. So even when health services are available, the experience with those health services is such that, many within our Indigenous communities don't feel that they can actually make use or take advantage of those services that are available. These are things that clearly have to be rectified. Very telling and very difficult statistics. And they reveal, to my mind, that we have a long way to go in terms of addressing the systemic barriers and racism towards Indigenous communities in Toronto. And these are not unique to Toronto by any stretch of the imagination. We know that these are reflective, frankly, of the racism and systemic barriers experienced by Indigenous peoples across this province and, frankly, across the country. Multi-generational stigmatization and inherent racism prevents access to basic health care, education, employment, and justice, much of which has been well documented in recent media coverage of the Colton Boushie and Tina Fontaine trials. We are fortunate that Toronto Public Health's Associate Director within our Surveillance and Epidemiology Unit was a co-investigator on the Our Health Counts study. And I can commit that these data will inform the ongoing work of the Toronto Indigenous Health Strategy, and with permission of Our Health Counts Toronto, Toronto Public Health plans to use key relevant findings as part of our 2018 Health Status Report, and we will use these data to inform our program and policy development so that we can address the impacts of colonialism, residential schools, and the intergenerational trauma experienced across the community so as to actually improve the health status of our Indigenous communities in this city. Both reports that I've just told you about, the Vital Signs Report and Our Health Counts Toronto, are available online, and I would encourage all members of the Board of Health to take the opportunity to review these reports and their findings. And I would extend that same invitation to members of the public who are here today. I would like to end my comments by saying that we are truly appreciative. I am truly appreciative of the commitment and the support of the Board of Health, without which our accomplishments in 2017 would simply not have been possible. We are very excited about what 2018 has to offer and are looking forward to working with you all towards a healthy city for all. Thank you, Mr. Chair.
Thank you very much. Are there any speakers to number one, reviewing the year? Any highlight that you want to point out? Councillor Doucette.
I really just want to
Or
thank...
questions of staff?
I don't have questions. I would like to speak.
Any questions? Sorry.
So we'll go to questions first.
Questions, okay.
No questions?
No questions.
I'm okay? Good. I want to start by thanking everybody, all the staff who work for Toronto Health. I want to thank the Medical Officer of Health. She's had a fascinating first year with us, has dived in both feet, both hands and everything. But it's also the staff who write these reports and the staff who help the staff who write these reports, who I want to thank. Without the background work, we as a board wouldn't be able to approve reports which come before us, because we need to know that the background work is being done, and we need to know that we are being proactive as much as possible when we're looking at the health of our residents. As we found this year, situations come up and we have to take them seriously, and we have to do what we can in our power to help the people across the city who need that help. So just quickly, I want to just thank everyone, because it is a big team effort. And I know Medical Officer of Health is the one who comes and reports to us, but it's her team behind the scenes who do a lot of the work. So thank you very much.
Thank you very much, Councillor Doucette. Councillor Shan.
Thank you, Mr. Chair. I also want to congratulate and thank you for the work that you have done to the Medical Officer of Health and all the staff and all the frontline staff who've done the work, and the board. But I also want to mention that, the success or the kind of improvements that we've been making, even though not far enough, came as a result of a lot of advocacy from community members and organizations and activists, both on the opioid crisis as well as on the shelter crisis. We have had so many individuals who came and deputed and who came and advocated for that. And I also want to say that, it is a partnership between the Board of Health and the community members and advocates that we push the agenda of progressive change in the city. And I'm happy to be part of the movement, but also it's their work that drives the success that we have as well. Thank you.
Thank you very much. Peter.
Thank you, Dr. Devella, for this good overview of the year's work. And congratulations to all the public health that has been doing excellent work. My question is, are we moving forward? And that's not, I didn't hear that in the review. Are we closing the gaps on health inequity? Do we have indicators that show us that the population actually is getting healthier? And maybe that's in the vital signs report, but I just didn't glean that from your report. Thanks.
Thank you. No, you're done. Okay, anybody else? I'll just add some comments. Just looking back on 2017. 2017 will go down as a year where there have been lots of good work overall, and sometimes that isn't sung enough. But we know that many areas of public health are taken care of by our very competent, almost 1,900 person staff. So I will only say thank you to them, and thank you to senior management and every frontline worker for the good work that you've done this last year, of course. The highlights for me, one is at this time last year, we didn't have a medical officer of health. And, changes in senior leadership always carry with them risk and opportunity. And I think we've landed in a very good place. I'm really delighted to work with Dr. Davila, speaking as chair, but I think you've added stability, and we're in a good place. And I think that process that we went through was a good and healthy one, and we made the right choice, and it is showing itself in this first year's work. A second thing that I think I'll remember 2017 for is, and Yvonne DeWitt is here, is that we finally made that 20% funding of student nutrition programs. Trustee Glover will, and your folks will certainly appreciate that. And Yvonne, that has you written, sorry? Carol Timmings is part of that. Sorry, yes, but I see Yvonne at the meetings, but I know it's you, Carol, as well.
Well, it was, so.
Yeah, before, but there's a whole team of people that have been part of that. And here in the city of Toronto, if you look at us nationally, we are the one city where we put in 20% of the cost of the program, province puts in 11%, and hopefully there'll be some good budget announcements in the next few weeks. The feds put in nothing, absolutely nothing, but they're kind of inching their way along to seeing that they might find possibly at some future time, phased in over a gazillion years, opportunity to do that. But we did it, and we've been struggling with that one since 1992. That's how long it has taken us to get to this point, and we had basically achieved our goal. Another highlight this year, if you remember, And, you know, sometimes you think here, we're just pushing paper around. Does it make any difference? The Urban Health Fund, which does really key work with our community agencies, they asked for a phased-in increase. We gave them that. Then we also asked out of this process here, I think it was Councillor Cressy that moved the motion to say, okay, they need another 15% to meet unmet demand, and demand was there on the street, but we couldn't meet it. And we got that through the budget process as well. The big highlight for me will be, frankly, the work around drug strategy. You know how sometimes in life you look back and say, holy smokes, was that ever transformative? And, you know, we've had a few of those experiences, at least during my tenure on public health. One is certainly around smoking. Years ago, this room would have already been a cloud of smoke. And then something happened in 1995, it didn't kind of go through, and then it happened again in the year 2000, and it went through, and the world changed in a pretty dramatic way. And in another example is, of course, pesticide. Like now, no one thinks of putting cosmetic pesticide on their nice Kentucky bluegrass in their front yard or their backyard. You just don't do it. Well, those were all big fights. Those were things that we really had to wrestle deeply as a Board of Health and as Council to get implemented. Drug strategy, all of us remember, well, we're still in it, that we thought we could police our way through this issue. We thought that we could, through the court system and through getting tough on drugs, we could deal with the issue. And after hearing from the police that, you know what, we're not going to arrest our way towards solving it, we need a different kind of approach. And we took that approach in 2017, and I will not forget those deputations here. I can remember each of those days going home absolutely exhausted because of the stories that people told us, personal or about their friends and family members. And we've turned a corner. I think we are at the beginning of a very, very different Canada-wide, province-wide, Canada-wide, in fact, international approach in how we deal with drugs. That is as distant as possible from stigmatizing people and as close as possible to seeing it as a health issue or set of health issues and not a set of criminal justice issues. I think it's going to save us money, and in 20 years, 10 years, when the next few boards of health look at that issue, they're going to say, holy smokes, 2017, something interesting happened that year in Toronto, and that helped us as a society turn the page on an issue that was really perplexing us. So I have lots of good things to say about 2017, some smaller, some bigger. So those are my comments. Anybody else? Okay, so the motion is really to receive this report for information. All in favor? Opposed, if any? That's carried. The next item is 25.3, increasing access to cooling in the community. We have a presentation. Dr. Davila.
Yes, so as we get our presentation set up, I'll just make a few remarks of introduction. On behalf of Toronto Public Health, we're pleased to bring forward this plan to enhance access to cooling in Toronto. And again, the presentation you'll see is in respect of item 25.3, increasing access to cooling in the community. This report before you outlines a proposed approach that's based on our review of available evidence and practices in other jurisdictions, with the ultimate goal of protecting the most vulnerable from the health impacts of hot weather. And as we have slides up, my colleague Kate Basil, who's our Acting Associate Director of our Healthy Public Policy Directorate, will be taking you through a presentation that provides further details on the report and the recommendations that we're putting forward for the Board of Health's consideration. So over to you, Kate.
Thank you. Good afternoon. I'm pleased to share this presentation with you that provides an overview of the report entitled Increasing Access to Cooling in the Community. As will be discussed in this presentation, this report outlines a proposed plan to maximize access to cooling for those most vulnerable to the health impacts of heat in the city. This report originated from a Board of Health request to review access to cooling for people at risk of heat-related illness on days when heat warnings or extended heat warnings are issued in the city. It also responds to a request from City Council last year that the Medical Officer of Health review Toronto's cooling centre program specifically. So the report before you today responds to both of these requests, and I should mention it has been prepared in consultation with many of our city partners, some of whom are here today, including Shelter Support and Housing Administration, Social Development, Finance and Administration, the Office of Emergency Management, Parks, Forestry and Recreation, Toronto Libraries, and Employment and Social Services. The report itself provides an overview of current access to cooling in Toronto, and it identifies some common features of heat relief facilities across North America. An approach that is commonly used in other jurisdictions is a heat relief network that I will explain in a bit more detail shortly, but essentially it's a system where many publicly accessible air-conditioned spaces are available and included as part of a broader network that makes a heat relief network. A heat relief network has been found to be an important component of hot weather response in many cities to maximize access to cooling. Based on these findings and some discussions that we've had with city partners, this report proposes a trial of a heat relief network for Toronto for this coming summer. This slide provides an overview of the evidence that informed the report. So at Toronto Public Health, we examined heat relief programs in other cities, and we searched for available information about cooling centers in particular. The Center for Disease Control in the United States actually released quite a comprehensive report last year that discusses the use of cooling centers to prevent heat-related illness. So as a result of this review, we found examples of programs that maximize the number of facilities that are designated as cooling centers to form a large heat relief network. And they select facilities where people already choose to spend their time, so places that are familiar to people. So for example, it could be municipal buildings, nonprofit, faith-based, senior centers as well. In addition to this scan, a survey of cooling center users was conducted in 2017. As you may recall, that was an uncharacteristically cooler summer. So the cooling centers were only operating for 7 days in that summer, in June at the end of September, and as well at the end of September, so not even in sort of that core summertime period. We did conduct an exploratory analysis of the survey, which suggests that a majority of users walked to the cooling centers and stayed for a short period of time. However, it's really important to emphasize that given that cooler summer, we were unable to collect enough information to gain a complete picture of cooling center use. And so additional time is needed to extend this survey to more fully inform the work. The next two slides provide a picture of the potential expansion of heat relief facilities that could be achieved through a trial of the heat relief network. So this is a map of the current locations of the 7 cooling centers. These are designated air-conditioned spaces that are located at 3 community centers and 4 civic centers across the city. They are staffed by people with lived experience of homelessness, and visitors have somewhere to sit, access to water, and a snack. While we know that spending time in an air-conditioned environment during hot weather is one of the most effective ways to reduce the health impacts, geographical location may limit access to these sites. And as shown on the map, the cooling centers are relatively distant from each other, and many parts of Toronto are not well served. There is an opportunity to expand access to cooling in Toronto through the broader promotion of the city's libraries and community centers as locations to cool down. Potential locations that could be included in a heat relief network are shown on this map, which illustrates how access to cooling could be maximized with this approach. These sites have air conditioning and have access to seating and water. An advantage of this approach is that many of these locations are near where people live, and they're places where there are activities and programming underway. They also include many facilities that people already visit and are familiar with. These features address challenges that have been identified previously, including feelings of reluctance to visit centers that do not have programs or activities in place, and hesitation to travel to unfamiliar places. The network could be further expanded in the future. Toronto Public Health could explore including other organizations with air conditioning, for example, provincial or federal buildings, museums, and faith organizations. So for 2018, Toronto Public Health proposes enhancing, organizing, and communicating the role of libraries and community centers as cool spaces as part of a heat relief network trial for the summer of 2018. This would include training host facility staff, proactively promoting the network, and creating materials for education and outreach. The 7 existing cooling centers would also be members of the heat relief network, and together these facilities would be promoted during a heat warning or extended heat warning. Other activities that are part of Toronto's hot weather response would continue to ensure a comprehensive strategy with multiple approaches. The last slide provides a summary of the recommendations that are for your consideration today. The first is for Toronto Public Health to continue to work with other divisions, including Shelter Support and Housing Administration, Toronto Library, and Parks, Forestry and Recreation to trial a heat relief network that would maximize access to cooling within neighborhoods and in areas that people already visit. In light of the cooler summer last year, the second recommendation is that Toronto Public Health continues to review the cooling center program during the summer of 2018 in order to determine its role as part of a heat relief network. The next recommendation is that Toronto Public Health will continue working with Shelter Support and Housing Administration in order to determine how to best integrate the heat relief network locations and facilities that serve those experiencing homelessness. Toronto Public Health would plan to report back in early 2019 on the results of the trial heat relief network. Our expectation is that this trial will inform the development of a longer-term approach to ensure access to cooling for Toronto residents during hot weather to best protect the health of those most vulnerable. Thank you. This concludes the presentation, and I understand that Dr. Davila has some concluding remarks.
So thank you, Kate, for the presentation. And if I can, just to summarize, so the notion is for us to actually conduct a trial of a heat relief network over the upcoming summer. In producing the trial, so we're proposing that we develop and design a trial and actually identify and resolve any issues with our implementation partners across the city, so that we can then come back subsequently to the Board of Health with plans and a proposed approach for the future beyond this summer. So with that, I'll turn it back over to you, Mr. Chair, and we're happy to take any questions.
Thank you very much. Are there any questions? Oh, Councillor Layton, sorry.
Yes, thank you very much. How do you treat the outside business hours now in the cooling centers? Like, what happens after 6 when the building closes, or 8, or?
So the 7 city cooling centers that currently operate, there is one that operates 24 hours, and that's Metro Hall.
Okay.
The other ones have, I don't know offhand their hours, but they're you're right, they're sort of a 7 to 7 or some other hours, with the exception of Metro Hall. So I think at that time, where possible, staff at the cooling centers can advise people of where they might go. So for example, if they're referring them or suggesting to go to a drop-in or the referral center.
So there's no discussion about keeping the centers open longer, or?
Not that I'm aware of, but I think this issue, though, of hours in terms of accessibility, I think that's an important part of thinking through a heat relief network and understanding accessibility of what organizations are available at what times and where there are opportunities for enhancements to be made within a broader relief network. 'Cause the advantage of some of the libraries or the community centers is they may have those longer hours.
Do we have an idea of the demographic that's been using the cooling centers and whether or not they'll feel welcomed if we open up the other community centers or the libraries?
So that is one of the aims of the survey, that we did collect a little bit of information about this summer, but we're quite limited, and that's part of the reason of extending that to next summer to get an understanding of that. I will say, though, that what we do know, one of the advantages of the cooling centers currently is because there are people who have lived experience with homelessness who are staffing those centers, that can be quite welcoming for many of the visitors. There has been some work that's been done elsewhere. So there was a sort of a user profile that was done in the cooling center network in Arizona, and they found quite broad demographics in terms of who was actually visiting the center, whether they were coming for a program already there or specifically for the cooling center. They felt it was reaching a vulnerable population.
Okay, thank you.
Sorry, Councillor Shand, then Councillor Doucette, and myself.
Councillor Layton asked part of my question around the sensitivities and the training that would be necessary if you were to expand thing. So there's a spectrum of people who might need it. Obviously, the most vulnerable are people who are homeless and in difficult. But we also found that a lot of children and a lot of elderly folks were impacted by it. So is there a way? I know we went within our jurisdiction, but some of the things we were dealing with were in schools. And is there a direction that Toronto Public Health would take in terms of advocating for certain standards across other places? For example, TTC. Many folks in the Etobicoke, Scarborough areas sometimes are in the bus for like 45 minutes, 1 hour, without air conditioning. And there's not really an option of getting off into a cooling center and stuff like that. So is there a particular standard that we can apply just as a thing to communicate to make sure that that schools or I know it's a different jurisdiction, but we partner. Toronto District School Board does not have a public health angle separate to it, but we are part of that institution.
So through the chair, a couple of things. One, this very specific proposal is around a heat relief network, and it's not meant to, and I don't think it pretends to solve all the problems, but it is a beginning step with respect to how we can actually address the negative impacts of heat on health. I think the other piece that's important to mention here is that when we look at the review of the evidence, the notion is that being able to provide some degree of access to cooling for people who are vulnerable to the effects of heat over the course of the day is what's important and what's been proven to be of benefit in terms of protecting and promoting health. So, you know, the standards with respect to what a specific transit ride might look like aren't really contemplated in the evidence, but that doesn't mean that we're not willing to work with other city partners, which would include the TTC, in respect of what might make sense in their facilities. But first and foremost, heat relief network to provide access to opportunities to get cooled off on those days when heat alerts are called. That's the first premise here. It's a trial. We're going to work with our divisional partners, and so as not to bite off more than we can chew, and so as to ensure success. We're proposing these partners first, which doesn't mean that we're not going to speak with others, but the focus will be in these arenas as described first, and then proceed from there.
Thank you.
Thank you. Just may I add that all TTC buses, I think, are air-conditioned. The new streetcars are, the old streetcars are not. And I think the subways, the Yonge University line is, but the Bloor Danforth line is not, but will be with the next purchase. Yes, yes, that's right. Councillor Doucette, questions?
Thank you very much for this report. We're talking about, and I love the new, I think this is to me a new terminology, heat relief network. I love that because you're saying we have 7 cooling centers with a possibility of nearly 200 what I would call cooling spaces. Can you tell us the difference between a cooling center and a cooling space? Because I know there's quite a big difference.
That's right. So the cooling centers, as we currently have them in Toronto, they're at community centers or civic centers where there may be a space. So for example, in Metro Hall, there's space set up in the lobby with tables. You're greeted by 2 staff who will offer you water to drink, a place to sit and rest, and a snack available. But it's really quite specific to a place to rest and get cool for a short period of time. They typically don't have a lot of activities or programs that are underway. Whereas the idea between using these pre-existing facilities like a library is that you could go in and have a glass of water and somewhere to rest, but then maybe there's an activity happening at the library. You can sit and read a book, and there are other things going on there that you may stay a bit longer, or you may be there anyway, and it's an opportunity for staff to kind of integrate that service or providing a cool space in the services that are already provided. That's sort of essentially the difference.
So the cooling centres, we guarantee somewhere for you to sit, somewhere to get probably water and maybe a small snack. But the cooling spaces, obviously there's many more, but at least it is a place with an air-conditioned building.
That's right, exactly. So I think that we know from the literature, having that access to a cool space, whether it's for an hour, that does have a positive impact in terms of reducing those health impacts. So it's sort of a layering. We recognize that multiple strategies are needed and that people need to be able to access somewhere maybe that's closer to where they live, so that this would enable that.
I don't know if you can answer this, but I'm going to ask anyway. Sorry. On page 6 of the report, we're talking about continue to engage landlords. And it says that the landlord licensing bylaw came into effect, led by municipal licensing and standards. As a result, landlords now are required to post the location of a nearest publicly accessible air-conditioned building, could be a library or community centre. How the heck are we enforcing that?
In terms of the enforcement, I'm not able to answer that,
yeah.
but this is something that came into effect last year that we were supportive of in terms of at least providing information to residents of where they could go that is the closest space where they could access somewhere to cool. In terms of the question of enforcement, I would have to refer that to Emma.
And we have staff here
Oh, right.
to help answer that.
And I guess my follow-on to the same question is, how have we promoted this to tenants of buildings? I'm assuming this is multi-residential buildings. How have we let our tenants, residents, know that their landlord is supposed to be posting this? Because this could be a very crucial point. Instead of having someone sitting in a unit really, really hot, not knowing where to go, this information could be crucial. How are we moving this forward?
Through the chair to Councillor Doucette. Hi.
Hello.
Yeah, so this is a new requirement that came into effect with our bylaw in July 1st of 2017, and part of that is that they have to have what are called tenant notification boards, which is where this information is to be prominently displayed and posted for tenants. So we've just been doing evaluations of buildings for ensuring compliance with our standards. So come the spring of this year and over the summer, we'll be further engaged with the landlords to ensure they have the notification boards posted and the requisite information displayed. In terms of informing the tenants of this availability or this requirement, through the implementation of the bylaw and through all the council meetings and dialogues with the tenant stakeholder groups, they've been made aware that this is a requirement. So I think through organizations such as ACORN, FMTA, that information's been provided, as well as our website and providing information to tenants on what information our bylaw requires landlords to comply with. That is another way we've been making tenants aware of the requirements. So I think collectively, as well as the work that's being done here with Toronto Public Health, that the word will get through to the appropriate people to make them aware of it.
Could you maybe send out notices to councillors' offices? Because a lot of us do e-newsletters, and a lot of our residents who are tenants hopefully do follow our e-newsletter, and we may be able to help spread the word further. So if you could send us a blurb, paragraph or two, which we can put in our newsletters, that'd be really, really helpful.
We can do that.
Thank you.
Thank you. Just a question on, I'll put myself on the list to ask. In terms of location, so this year it's libraries and city-owned community centers. So Piccinini is JJ Piccinini Community Center, that's in, but I don't know, Witchwood Barnes is not in.
Right, so that's right. So as part of the plan, as the first phase, as part of the first trial to see how this would work, the proposal put forward is to include libraries and the city-owned community centers as step one. That being said, there's potential, depending on how that trial went and reporting back to the Board of Health, I think there's potential for that model to be expanded longer term.
To include things like?
Well, what
Baycrest.
so what we see in other jurisdictions is they go to other levels of government, their buildings, or they go to private organizations, museums, places that are open to the public and maybe have an air-conditioned lobby. There are not-for-profit organizations who volunteer in some communities because they want to sort of be part of that effort. So it has broadened in many other jurisdictions.
And so you're going to follow the ball, and if there is a spot, I don't know, in, just thinking Baycrest, in north part of Bathurst Street, you're going to phone them and say, hey, you know what, we've noticed a lot of complaints in this area, can you be part of the answer?
That's right. So that's part of what we've included in the report as part of what we would do in the trial is start to explore what are sort of other organizations or what, if things were to broaden, what would that look like? Who are, places or agencies we could partner with?
Right. And could you address the communication strategy just a little bit it sounds like we need some hard copy stuff, some electronic stuff, especially given that the community that would probably benefit from this might not be being more senior, might not be as electronically present.
That's right. So I think, the communication strategy is key, and we recognize that we need to have, there'll be sort of a group involving our partners with other divisions to look at communications. What we understand from other jurisdictions is it's sort of multiple. It's having maybe signs when people are walking by that they can see a sign. It might be reaching out through newsletters or social media, but that there's multiple strategies that need to be, but it's absolutely, as you say, it's sort of critical for people to be aware. So that is something that will be part of the network that will be discussing what is the most effective communication strategy.
And just addressing my last question, addressing the most vulnerable, and that would be people who use our hostel, respite, and drop-in system. Do we have an audit of which ones are air-conditioned and which ones are not air-conditioned?
So I will, we do have a colleague here from Shelter Support and Housing, so I'll ask Laurel to answer that.
Laurel is here from Shelter Support and Housing. I'll just add, since we last talked about this through the chair, that the drop-ins are the most functional of those options that you mentioned, and this is why we are really designing this network as we speak, even to get ready for the trial this summer. So the drop-ins are good because some of them have extended hours, most are air-conditioned, and there's around 50 of them across the city. Right. So that's the group we'll focus on, but I'll let Shelter Support speak to your specific question.
I think as part of the work with TPH in developing the network, we'll do an inventory of which sites are air-conditioned and can provide that.
Do you think that on a go-forward basis, because I know we're also improving our shelter standards, or reviewing them anyway, that this should be a requirement that if you want a shelter, or at least the new ones, and maybe we have to figure out what to do with the ones that are already in the system, but certainly the new ones, that's frankly how they're going to be built.
Yeah, as part of our best practice design guidelines, we can certainly look at that.
But it's not policy yet? No, okay. Okay, great. Okay, so there's a piece of work that we need to do there, because we are expanding the shelter system by 10, and that doesn't include the new Seton House and the drop-in centers. I think we're doing a review of them as well, and there's an opportunity there to up our game there. Okay, great. Okay, thank you very much. Are there any speakers to this? I'll just echo Councillor Doucette's that this is great work. We don't have 7 or however many we had last year, 6, 7, whatever the number was, small, under 10 anyway. Now we have 200. It is a bit of a mixed bag with libraries and community centers in that, but I think it's one that's highly decentralized, and I look forward to actually seeing that list increase. I think it will increase in a natural kind of way, and to me the key will be getting the word out for those heat alert days. We had a good year in 2017 in terms of a lack of heat alerts, but global warming is not going away. I think 2017 was an anomaly. And for those of you who aren't councillors on the Board of Health, I'll tell you, when that heat hits, we get the calls. And so to be able to point to something and say, okay, we do have a response, and of course, by the time people call, they have that sense of desperation that they just can't take it anymore. To be able to say, no, you don't have to travel halfway through the city to get respite for a few hours, but you can just go to your neighborhood community center or library, I think is a great respite. So thank you. Okay, so there's motions before us. Seeing no further speakers, all in favor, opposed if any, that's carried. Thank you very much. Now we have one more item, and that is the issue of public health approach to community violence. Trustee Glover, do you want the deputations first? We're going to be in your favor, okay, which is our normal order.
Yeah. Okay. So would I get to
be this? You'd be the first. Right now? Okay. Just for your 5 minutes? Sure. Yeah. Absolutely. Well, so. He's not deputing. He'd be speaking from. He can speak over there. We do that all the time. Yeah, and he can speak from there. Okay, do you want to speak from there? Is that okay? Yeah, that is, yeah.
Now, I know there's at least one person in the audience who's taking the effort to...
We'll arrange it. Yep. Okay, so you have 5 minutes from there to speak. You're not deputing technically, but you're speaking. You have to press the button there.
Okay. I saw Councillor Cressy do this one time to set up a motion. I wanted to introduce this motion and just introduce the topic so that you'll know what people are speaking to when they depute. I apologize. I didn't understand the processes here, and so the motion's coming in late, but I'm thankful, to the members of the Board of Health for adding this on at this time. This motion is actually the reason that I'm on the Board of Health. I became a school board trustee in 2010, and since then I've attended 7 funerals of young men killed in gun violence. And I started to realize, I started to research it, I started to have meetings about it, and I realized that the trauma that extends from that, it's not just the loss of those lives, and it's not just in the immediate families, but the trauma from gun violence extends to family, friends, and entire neighborhoods. And I'll give you a couple of examples. One young woman that I know who had just graduated from one of the high schools in my area, she lived in a townhouse complex. And she and her mother were walking out the house one day, and she sees her friend on the next door porch, and so she waves to her friend, and then a car pulls up, 4 guys get out, and they start shooting at her friend. So she grabs her mother, they go back inside, they lock the door, and they realize that their friend had just come in a car to pick her up. And so they're phoning their friend to find out if she's okay. They finally get a hold of her, and she's hiding under the steering wheel of the car that she's come in, and her car has been shot up. After that incident, this young woman told me her sisters, who were still in school, were too afraid to go to school. So we sent a social worker to go and talk with them, and eventually they were, they felt comfortable enough to go back to school. Another incident, and there are many that I could speak to, I was speaking with a grade 5 class, and I was responding to letters that I'd received as a trustee, and somebody mentioned in one of the letters that they didn't feel safe. And I asked the students, how many of you don't feel safe? And half them put up their hands. And now it's 10-year-olds, 10, 11-year-olds. And so, some of the things they didn't feel safe were 10-year-old stuff. Like there was a dog that walked into school one day, and they all panicked and ran into the school. But another boy described going into lockdown in his apartment because a gunfight erupted in the neighborhood. And he described it as, we knew what to do because they're taught at school. So they, closed the blinds, they locked the door, they barricaded the door, they went into the bedroom, they barricaded the bedroom door. And, he's a 10-year-old boy, so he's describing it as, and he's saying, but my 5-year-old sister, she was refusing to stay quiet. And so he was really frustrated with his 5-year-old sister. But I'm thinking about this 10-year-old boy's experience. Like, I'm hearing the story from a 10-year-old's perspective, but his experience growing up is going through, lockdown in his home because of a gunfight. So I've started to research the impacts of exposure to community violence. And there's a lot of research from the United States, and among the impacts are anger, aggression, fear, anxiety, depression, post-traumatic stress disorder. It impacts people's parenting skills because when parents are grieving the loss of a child, it often impacts their ability to raise their other children. There's another thing too that came up in the literature that I didn't expect. It's shortened life expectancy. And so in the literature, they describe it as the expectation that you will live to the age of 35. And people who live in violent neighborhoods often don't have that expectation. And so with that shortened life expectancy, it leads to all kinds of high risk-taking behaviors, because if you don't know how long you're going to live, then you do things that other people wouldn't do. And there's one quote in one of the research papers that really summarized it. It was a 10-year-old boy, and he said, he was asked by a journalist, what do you want to do? What do you want to do when you grow up? And his response was, if I grow up, I want to be a bus driver. Okay. Anyway, so it just speaks to the poignancy of this. And what they call in the literature exposure to community violence is actually called street trauma. And I just came across that term last week. And, I mentioned 7 funerals. I started doing this research in like 2012 and started working on this issue. 2 years ago, one of the young men who was killed in the city was a friend of my son's. And when you see your 18-year-old son and all the kids that he grew up with gathered around the casket of their friend, who was killed in this way, it just changes everything. And it gave me some insight into the type of trauma that people in this city, many people in this city are facing. So the motion is there's a few parts to the motion. The first one is that the Board of Health recognize exposure to community violence as a social determinant of health. And I think the research and the report that I've brought forward clearly, describes that it absolutely is a social determinant of health. The second part is to do research in order to develop a plan to address street trauma. Because in other cities, and especially in the United States, this is much more prevalent and it's much more studied. And I think that street trauma is an underdiagnosed public health issue in this city. So I'm asking for that research report to be done. And the other piece of this, and the other reason that I'm bringing this forward, is a public health perspective changes our thinking about gun violence. And there's a program in Chicago called Cure Violence, and it was started by an epidemiologist. And the epidemiologist, he was working in Africa on the Ebola and the AIDS epidemics, and he came back to Chicago and he realized that gun violence is also an epidemic, and it follows the same pattern. And with any epidemic, if you want to stop the epidemic, you have to interrupt the spread of that epidemic. And so he's created a program called the Interrupters, which hires people with the credibility, many of them are ex-convicts, to go into neighborhoods and to negotiate peaceful resolutions to conflict, and also to teach people, nonviolent ways of resolving conflict, so that violence isn't, like, we're all humans, we're all going to have conflict, but to teach that the first response to conflict shouldn't be to resort to violence. The other piece of this that I think needs to be said is that there is a growing gap between rich and poor in this city. And that growing gap is the breeding ground for community violence. And any decision that this city makes, that any level of government makes, should be looked at from that perspective. Is it going to increase or decrease that gap between rich and poor? Because if it's increasing that gap between rich and poor, it's feeding into this cycle of community violence. So that's why I've brought this motion forward. Thank you for giving me the time. We have a number of deputants who have firsthand experience with community violence, and they've come to speak and share their stories.
Thank you. Just so you're introducing this motion?
Yes.
At this point, just so it's on the table and the clerk can distribute it so that you have it in front of you. He's the first speaker, so we're using his 5 minutes. We've kind of structured it. He's using his 5 minutes now. So if there are questions of the mover of the motion, now might be a good time to, now is the time to ask him those questions. Okay. Councillor Shan.
Just some clarity. I'm very supportive of what you're saying. I want to make sure that when a motion gets to the public health, it's the most effective thing rather than it acknowledges something but doesn't move in the direction you want to.
Right.
Do you agree that community exposure to racism is a social determinant of health?
Yes.
Okay. And when you talk about violence, you predominantly talked about gun violence or quote unquote, gang violence, or you talked about physical violence outside in the community, in the street setting.
Yeah.
But it doesn't say that in your first sentence, violence. It says community exposure to violence be recognized as a, yeah. So is there a reason why the motion is not specifically talking about gun violence or physical violence, or you want to make sure that it covers a broader?
It's the term that's used in the literature is exposure to community violence. So it's not, and they use it to distinguish between community violence and domestic violence.
So I have here community exposure to violence. You're talking about exposure to slightly,
yeah, it's a slightly different. Do you think? Are you suggesting that we rearrange the words? Does exposure to community violence capture more of what you're trying to say?
So I don't know if it changed here. What I have here from your email is community exposure to violence as a social determinant. Yeah. Community exposure to violence, but you're using the word exposure to community violence.
Right.
I don't want to, community violence could be interpreted in a way that certain communities are seen problematic as violence on neighborhood, right? And how do you take a systemic approach to this rather than a kind of a pathological approach to certain neighborhoods or communities?
Yes, exactly. Exactly. That's what it's intended to do.
Okay. And so you are asking the Board of Health or the medical officer to report back in July. Mm-hmm. Is that reporting back including the possibility of exposure to violence being recognized as a social determinant, or you want that to be decided today?
That I want to be decided today.
But the other bullets in us.
But the research report,
other points,
at least the plan for the research report would be coming back in July.
Okay. Thank you.
Yeah.
Great, thank you. Other questions? I'm just wondering, you're okay with actually changing community exposure to violence to exposure to community violence?
Yes.
It's a technical term that you've kind of introduced, and I think precision is going to be important here.
Okay.
Yeah, okay.
Yes.
So we'll ask the clerk to make that a friendly amendment now that she's printed up the old ones.
Okay.
Okay, other questions of the speaker? Okay, thank you very much. We will now just adjust the order of things and go to deputants. We have about 10 deputants here, but I understand, Trustee Glover, that there's someone who has some real strict time constraints that would like to go first. Can I ask? Yeah, we'll get them to sign up. So there's no one here that has strict time constraints, like really big double duty time constraints? Okay, there's one. What is your name, sir? Jason? Okay, so you're one of the ones that isn't listed yet, but go ahead. If you have a time constraint, then I'll invite you to take the floor, or take the seat there. And just for those of you, I have a feeling many of you are here for the first time. The way that deputations work is you have 5 minutes to us to say what needs to be said. We have an opportunity after that to ask you questions, and then we invite you to take your seat. At a few seconds before 5 minutes, just so that we're fair to everyone, I kind of give a little signal, like take the talk home, yep, or finish up, and then hopefully you can finish up in that. We really hope that you can finish in that 5 minute period. Okay, that's and we're the same for everyone. Okay, thank you very much, Jason. You have 5 minutes.
All right, my name is Jason Wisdom. I was recently exonerated for a crime from 2004. I was in prison for 13 years and 4 days, wrongly convicted. It was the case was gang violence, Scarborough, Galloway murder, a whole bunch of things. But during that process, while I was incarcerated, and while I ended up getting exonerated, I met the Think Twice group with Isaiah Brown, and that group would come into the prisons and work with the guys on many different streets and violence. And part of what I do is speak to the younger guys about gang violence and how not to get trapped up in that. Because what happened to me was I grew up in a neighborhood like that. Ended up, instead of being involved in violence, I got twined up into a whole different everything where I ended up wasting many years of my life in prison. So I seen the effects of community violence directly upon the guys in there and the guys around the community, and how they behave and why they behave the way they behave due to the fact of the violence around them and the decision making they made, right? So I just wanted to let you guys know a little bit about me and myself and this group, Think Twice. Think Twice has been there for us, the only group I've seen that comes into the prison and actually deals with the guys in the prisons from the communities. So it's community, prisons, and they go all over to different prisons, right? In prison, there's nothing like that. The government doesn't have anything like that the guys can relate to like that, right? So, yeah.
Great, thank you very much. Are there questions of the Deputy? Councillor Doucette.
Jason, thank you very much for coming today. So if you gave us a wish list, not necessarily saying what Board of Health can do, but if you were to give us a wish list, this is a big question. What should the city, agencies, anyone we can bring in do to help youth not go down a path which will end them up in prison? I know it's a big question.
It is.
But we're always looking for suggestions.
The Board of Health?
Board of Health would be helpful, but you
Yeah.
can throw a few others at us as well if you need, but Board of Health would be, yes, preferable.
There needs to be more structure in the communities where the kids didn't have to grow up like I did. Like when I seen violence and I seen crime firsthand, that type of stuff needs to be not in their upbringing. You know what I mean? If there's a way where it can be, I don't know if public health, I don't know who. It's pretty big. It's a big issue, but just growing up and seeing that led me down a path that led me getting caught up and wrongly convicted. So that type of, I feel if I grew up somewhere else where I didn't see that, I wouldn't have ended up like that. You know what I mean? So I don't know, it's hard, it's a tough question.
So if Board of Health or Toronto Health worked with other city divisions to put activities into the community so that people aren't bored?
Yeah, actually pro-social stuff that the community, the kids want to do. You have to ask them what they like instead of just giving them stuff.
Yep.
They might not use it. They might not go to that rec center for whatever reason. So you need to know what they like and what's gearing them. More trade-based stuff instead of just playing. You know what I mean? A lot of rec centers are more like recreationized. There should be some trade-based stuff in there too, so they can actually make money and don't turn to crime.
So talk to the community, find out what programs they're interested in, and then try and find either the city or group who can provide this program. Excellent ideas. Thank you.
Much, Jason. Any other questions? Seeing none, we'll invite you to take your seat. And we'll go to Nigel Bariff, Urban Alliance on Race Relations. I saw Nigel here. Followed by Sky, followed by Evelyn, followed by Joan. Nigel.
Thank you, Chair. Thank you, Chair, and thank you, Board, for allowing me to speak today. My name is Nigel Bariff. I'm President of the Urban Alliance on Race Relations, and for over 40 years, we've been fighting hard to try to reduce racism here in the city of Toronto, and so we work with communities across the city. The other hat I also wear is as a school teacher, and just before I guess I kind of just jump into it, I wanted to share with you one of the things that makes this motion personal for me and why I support this motion so much. It was just 2 years ago that one of my students, a beautiful grade 8 girl, just graduated, getting ready to go on to high school during the middle of the summer, got shot and killed by 2 of her friends accidentally with a gun. And You know, I think what made it so hard is just that the friends, I knew them. I knew I knew the two boys also that had the gun. And I remembered all of the times that we tried, you know, through different systems, specifically through the school system, to get the children help. They were in crisis, no one doubted that. But to get them the help of a psychologist or social worker for the family was extremely difficult, if not almost impossible. And I see this also with my own friends who, growing up in North Etobicoke, who've also, just like what the previous speakers talked about, when we see sometimes get caught up in gun violence, you know, through circumstance that they didn't mean to, it just didn't mean to, like, that's not what the direction that they meant to happen. And if we had more structures, that things might be improving. But I also want to draw to your attention to a report from school teachers. We just did it was a province-wide report, but many of the voices in this report on workplace violence or violence that happens in school just speaks to some of the issues that are going on. So what we're seeing inside classrooms right now are a significant spike in violence. So 79% of classroom teachers have reported that violence has increased. 75% have said that the severity of these violence incidences have increased. We also know that the violence is disrupting teaching and student learning conditions. So many of my fellow teachers, 83% of us are saying that it's having a negative impact on teaching. And again, just another story from my own classroom of a child that went into crisis and started throwing chairs. So when that happens, think about it. You have to stop the classroom. You have to take the children, you have to move the children that are not in crisis outside of the classroom. You have to try to call and get help from a principal or somebody to come down to help you manage while we somehow try to calm the child who's throwing things all over the classroom. And for me, I always think as a father, I think, what kind of impact is that having on the children that are actually watching this violence also happen? Many of my colleagues are reporting that we see that there's less support. So the frontline supports are often not available. Things like educational assistants, social workers, and child and youth workers are not available that would normally be able to support this violence within the school and within classrooms. And school administrators also know that this violence is a problem, and they're having the difficulty of not being able to report on it because they just don't have, their hands are being thrown up because they don't have the resources either. 77% of our members rate the action of school administrators to prevent the reoccurrence of violence as not effective. So what I'm saying here is what we're looking at is that this motion would be a very important start to try to start addressing the violence that we're seeing that's happening not only in the community, but it's impacting the teaching and learning inside of classrooms. And so I really do hope that today you will give the appropriate consideration and pass this resolution and start moving forward to try to reduce the violence within our communities. Thank you very much.
Thank you very much, Nigel. You have some questions. Councillor Layton.
Thank you very much. And this is a similar question to Councillor Doucette's of Jason when he was up there. We spend a lot of money at the city in the name of protecting communities. It's probably the biggest item line in our budget, $1 billion to the Toronto Police in the name of public safety. With your experience as a teacher, as well as your experience on the Urban Alliance for Race Relations, where could we have more of an impact? Or could we have more of an impact investing in other things? If so, what would they be? And what do you think they might be? And who should we be listening to when we're looking at our budget of $1 billion to spend on public safety? Where should we be going for that advice about how to spend that money?
Thank you, Councillor. one of the areas that many of us frontline workers, not only in education, but, you know, across other social workers and psychologists, we believe like every school, like let's just picture this. What if every school had a psychologist, had a child and youth worker, had a social worker, had a nurse? You remember those times when you used to actually have a nurse in the school? So that way, a parent or a teacher or some other caring adult could bring a child who's in crisis or bring the family who's in crisis to this right there in their community to be able to get the support that's needed. I compare it, or we compare it to having something like an out clinic, right? So that's right there at the school, because I mean, the schools are the front lines, and that's if we can look at this as preventative, you know, before, you know, preventing and these situations from turning into violence as the child or gets older. If we deal with these crises right there at the school, you know, I think that would be one way that the city might consider using its resources.
Thank you. Councillor Shan to ask questions, then Councillor Doucette.
Thank you, Mr. Chair. Thank you, Nigel, for your presentation and your remarks. So, trying to understand how recognizing the exposure to community violence can try to address some of those things. Are you, for example, looking at, you know, we talked about pesticide control as a mechanism that this Board of Health advocated for. So do you anticipate if this was to be passed, then we could advocate as a Board of Health for gun control or gun or do you anticipate public safety becoming a Board of Health agenda so we can actually look at more programs being invested? What would this do in terms of addressing some of the concerns? Because the concerns are not new and people have been raising this. Yeah. I think what is new is basically to try to put it on paper that this is a social determinant of health. Right. That's the new part. And how is this new part going to, other than the paper itself, going to shift? And I'm trying to get some idea so that the Board of Health can know the implication of this motion so that we can actually go in that direction.
Well, I think, you know, jumping off what Councillor Layton asked about, you know, the way that the priority that we set for our budget, I think by adding exposure to community violence as one of the social determinants of health, hopefully will then allow us to take a look at violence in a different way. Right now, we look at violence in a punitive way. We only really pay attention to violence when it happens, right? And then we find a way to like find the perpetrator and we lock the perpetrator up and, you know, we want to throw away the key, and we spend thousands of dollars more. Like, I mean, there's plethora of research that demonstrates that spending money on keeping people locked up costs society so much more than spending just, you know, a tenth of that percentage. I don't have the exact amount, Councillor, but spending a significantly less amount at the younger stages to prevent people from getting into that level in the first place. So what I mean, I think, and when I read the research that was developed through Trustee Glover, I felt, yeah, well, hopefully maybe this would give us a shift in our thinking. Instead of having this punitive way of thinking about violence, maybe we have a preventative way of thinking about violence. And that's, I feel, why I think this is an important resolution for us to support.
Thank you. Thank you, Councillor. Councillor, that's okay. I just have one quick question. Why do you think violence is on the increase right now?
It doesn't.
Where's it coming from?
You know, you heard in the preamble from Trustee Glover talking about the widening gap between the haves and have-not in our city. And sometimes this sense of hopelessness that can take place, a sense of not feeling like a belonging that also kind of happens, that us versus them, and I do worry about that. If that, you know, and I think we have to be careful of not racializing it, because it does see across, racial backgrounds also. It's not only coming from one community. This widening gap between the rich and poor is having a negative impact, and that research is also very clear that we've seen about how the effects of what happens when that gap between have and have not keeps widening, and City of Toronto has been ground zero for that.
Okay, second question is, and I appreciate you're a teacher, so you would have a heightened sensitivity to the effects of community violence within a school context. We're not teachers, or at least many of us around this table are city councillors. We have a heightened sensitivity to neighborhood impacts. Schools, you do have psychologists. Community have like squat. They have nothing. So if violence happens in, I don't know, I don't want to label anything, but say a TCHC building, and it impacts the whole building, they don't have a psychologist to throw in or a social worker to throw in, or frankly anything that could actually deal with some of the neighborhood harms. Is that not also ground zero?
Definitely, yes. I mean, and again, this goes back to Councillor Layton's and Councillor Shan, what they're inquiring about, why this motion is important. That's why we need to take that look. So maybe instead of hiring more police officers, what we have are, outreach teams that are built around this preventative harm that would have at its core psychologists, social workers, child and youth workers that would be able to work even proactively to build. Because an example of what happened was, I talked about the shooting of the grade 8 girl, and TDSB, wonderfully provided social workers and psychologists at the school after the shooting. But many members, because they didn't have a relationship with the psychologists, they didn't really have a relationship with the emergency response team, were very reluctant to even go, right? So, again, that goes back to your point. Like, yeah, it would be great if each building, each community had a team of people who went and built relationships with community members. It is a different way of thinking, and would be such a forward way of thinking for our city, and what a great example we'd be setting for the rest of the country.
Great, thank you very much. Anybody else? Seeing none, thank you, Nigel, for your helpful comments. Next is Sky Star, Higher Healing Counseling Services. Going once, not here. Okay. Evelyn Fox, Communities for Zero Violence. Welcome, Evelyn.
Hi.
Thank you.
Whoops. My experience is actually graphic, so I don't know how people are in terms of hearing it, but it's my reality, so it's something that I think needs to be heard. This is my son, my oldest son, Kissinger Gunn, who was murdered on September 11th, 2016. He was hit by a stray bullet outside of a club. I was at the hospital and watched him die for 15 hours, and the bullet actually went through his left eye and ricocheted through the left side of his brain and severed an artery at the back of his neck. And I watched his brain come out of his eye socket, watched the nurses take his brain in a rag and throw it in the garbage. I took a rag and wiped him clean because they're too busy in that unit to be able to wipe him clean, and I had family who was coming to say goodbye to him. So I made sure that the blood that was streaming down his face and out of his ears and out of his nose and out of his mouth was cleaned all day long for 15 hours. I suffered severe depression, anxiety, and I had serious thoughts of suicide, but I also had thoughts of retribution. So homicide, being a survivor of homicide with your child, it makes an irrational person have irrational thoughts. I raised my son to be a good person. I raised him to do good in life. He was the first one in my household, in my family, to graduate from high school. He was a mentor to his friends. He was always worked in the trades, and always if there was a friend of his that was going down, he would get them employed so that they would turn their lives around and have a different way of living. So he was an amazing father. Like now his children are acting out at school, they're acting out at home in terms of meltdowns when they miss him. My other son is 15 and he has gone to severe anger, to severe depression. And he's spoken, we're sitting outside in the backyard one day and he's just telling me that because he's under the age of 18, if he went and killed the person that killed my son, he would only do this amount of time because he's a young offender. Like, this is the type of stuff that goes through, and this is just my family. So, I mean, like, his best friend who is in this picture, and this is just my family. This is not even a full snapshot of my family. This is just some of the youth in my family. My son's best friend has cycled in and out of jail since his death. He has talked about his feelings like he's going crazy, and that he doesn't know how to go on the right path because my son was the one who always kept him there. Another one of his friends turned to serious drug use and a couple weeks have overdosed and is now deceased. So this issue doesn't affect just the immediate family, it affects the community at large. So, I mean, I don't understand why this hasn't been a determinant of health yet, because the stuff that we deal with it's crippling. It's like, I don't know what else to say about, like, I have to take time off work. I've had to take months off work. There's no supports in the city for us. There's no counselors that deal specifically with homicide. There's no groups that are ongoing except through the distress center that deal with homicide. I feel like I am alone. I feel very alone, even though I have the love of my family and we all stick together because we're close. Having your child die and having to witness what one single bullet can do to your child is like, it's heartbreaking. I can't, like, and heartbreaking isn't even an adequate word, because I honestly, like, every day I think, I have to live the rest of my life without this man again. I'm never gonna hear his voice again. I'm never gonna be able to have him hug me. He's never gonna have a dance with his daughters. 2 of his daughters are not even gonna remember him. And he was the most amazing father that I have ever seen, and he grew up with no father. So, I don't understand why this issue has not already been deemed an issue. The gun violence hasn't been deemed a health issue. Like, it is mentally tormenting, and then it leads to all the physical aspects. So I don't understand why it hasn't been deemed already.
Thank you very much, Evelyn. We share your grief. I think I'll speak for the board and for everybody in this room. Are there any questions of Evelyn? Thank you very much for having the courage to come and speak with us. Next, we have Joan Howard. Welcome, Joan.
Hi. Ooh, I just have to... My name is Joan Howard. My son was Kempton Howard. He was 24 years when he got shot. He was a youth worker at Eastview Community Center. He will tell the kids, you guys could reach for your goal, you don't have to sell drugs, you don't have to hold in guns or whatever. So he was a mentor. And he had just received a scholarship because he was going to be a physiotherapist. So he had just received a scholarship from the Boys and Girls Club. He had a birthday the 6th of December. On the 13th of December, the 12th of December, he saw these guys smoking weed in the parking lot. All he told these guys was, guys, take it elsewhere. Then one turn and say, who we think he is, police informer, we'll shoot him tonight. The reason why they say police informer, he was in partnership through 55 Division, through the EBA with the kids. The Saturday, they came where I live Saturday and they shot him. Yes, I was home. I heard a noise, but I didn't know it was a gunshot because I lived too close to the door to realize it was a gunshot because I had my 12-year-old son. He said, Mom, did you hear that? I say, yes. Maybe it's the elevator that banging together, somebody moving. The Sunday, he had to take all these kids to our Raptors game because he had gotten his scholarship was from the Raptors Foundation. And the Sunday, we had to bring in counselors to all these kids, which is tearing their eyes off. And like they will come up to me and say, oh, Miss Howard, I know who shoot Kempton. I say, you don't have to tell me. Go and, inform the police about it. After his death, I never went and see anybody. I never get help for myself. Reason being, I was approached to put scholarship in his name, park in his name, trophy in his name. So I forget about me and concentrate. In order to keep his memory alive, this is what I've been doing. My next son and I, we went astray. We lived in the same house, but things was far different. Because 12 years after, I had my second son. So the big one was like a father figure and a mentor. I grew up, my kids single parents, and I grew them old school. So by 16, the next one and I went on the wrong path. I mean, he never got himself, knock on wood to this day, he never got himself in trouble with the law. And it's recently, we just started to have a relationship. He was seeing somebody. 2014, I went to my doctor bawling my eyes out. But before that, I had suicidal thought. One night I took the pill bottle and just swallow. And my mom had to hide everything from me. When I went to my doctor, she said, but you're supposed to be a strong person. Because I was so busy being an activist among the guns, running here and there to everybody's funeral and wasn't seeing about myself. So she ended up sending me emergency. When I went, I saw a doctor there. The doctor, I explained what happened. He said, do you think I should send you home? I said, oh, no, I'll be fine. So I went home. And right now I go through depression. Sometimes I don't feel like getting up. I stay in bed for a couple of days. I might just get up, eat, and back in the bed. Yeah, but it's been tough for me. So, and then with the mental health in the community, like, they just come in like today and see about the kids and there is no follow-up to see how these trends and how these children is doing. So you find a lot of the kids that grow up under Kempton, some of them end up being good, some of them into flame, some of them into fashion, some of them, have good jobs, whereas others went astray, end up in jail and things like that.
Thank you, Joan, for your comments. Are there any questions from the board? Trustee Glover.
Hi, Joan. Thank you. Thank you so much for coming and speaking today. You mentioned that after your son was killed, you had trouble being the same kind of mother to your second son. And this is one of the things that's described in the literature, that when you're grieving, it's hard to be a parent. Can you describe that? Can you confirm, is that the case? Is it?
Yes, it was, because I remember a reporter, Kareem was sitting next to me, and a reporter came and was asking me questions. And I said, I just feel like to kill myself, leave me alone, and things like that. And then when I think, I say, oh no, I have my son next to me. Mm-hmm. So it dawned on me then that I have somebody else to look after.
Right. Okay, thank you.
Thank you very much, Joan, for your presentation, and we as well grieve your loss.
Thank you.
Our next deputant is Louis March, Zero Gun Violence Movement.
I'm really French, it's Louis. My
Louis.
mother would get on your case if you call me Louis in public. Anyway, it's not working.
All good.
I'm going to test this thing to see if it actually works.
You have to flip it the way you're looking at it, like pretend you're reading it.
Oh, okay, cool. I got to get one of these.
You can take that one. Just kidding.
Holy smokes. Good day. My name is Louis March. I'm the founder of the Zero Gun Violence Movement, and I'm here in support of Trustee Chris Glover's motion to recognize exposure to community violence as a social determinant of health. I speak with a heavy heart because this whole concept of zero gun violence is something that a lot of people do not share that as a possibility. And my response has always been that we already have zero gun violence in the city of Toronto. So why is it so difficult to understand it? Unfortunately, zero gun violence is only in certain communities for certain people. So we know the characteristics. We know the conditions. We know the profile. Why is there a difference between living in Rosedale and living in Rexdale? Rosedale, you wake up in the morning, you have a big smile on your face, you have great expectations, you have great resources, supports. Everything is working fine for you. It's a healthy family, a healthy relationships, everything is good. You wake up in Rexdale, it's the total opposite for some of these kids, right? Because they've been traumatized by violence in some way, shape, or form. Trustee Glover spoke about the life expectancy. There was one young guy that we work with, and he was 20 years old, and I said to him, "Happy birthday." He said he didn't think he was going to get to 20. They've given up on life. There's a program on TV called The Walking Dead. A lot of our young people in these communities have given up on life. They have no value for their life. They have no value for your life. They will talk about the rush that they get from pulling a trigger, right? This is the reality that we need to face. Toronto is an internationally acclaimed city. Every time there's an international survey, Toronto is top-notch, better than a lot of the cities in America and around the world, right? We're always in the top 10. Sometimes we're the top 1, so we're doing a lot of things right. But our challenge is what's going on in other parts of the city and why are we not addressing it? So Zero Gun Violence Movement is a collaboration of over 40 different organizations, agencies, programs across the city of Toronto that work towards this objective of zero violence. Our focus is about education and awareness about gun violence, because my mentor, Dudley Laws, always said to me, not one of these kids is born with a gun in their hand. Understand where the gun came from, how it got there, why they picked it up, then you find your solution, right? We work across the city of Toronto from one community to another. In a week's time, we might hit 4 different communities where there's struggle and where we're invited to come and participate in activities and programs. So we see the good, the bad, and the ugly in the city of Toronto. Unfortunately, we've seen a lot of the bad and the ugly in the communities where violence is normalized. Example, one community, a grade 4 student said to me, "I know where it's safe to walk in my community." What she's actually telling me, she knows where it's not safe. This is a grade 4 student. She also went on to tell me that violence is normalized in her community. This is a grade 4 student. This is not what you're supposed to be thinking about. I put this picture here because one community we were working in, this is a Sunday. No, this is a summer day. School is off. It's 3:30. You've got this beautiful playground, but there's no children there. The community is on shutdown because this is not a safe place to be. Now that I know how this works, cool. Another picture. Same community, 1 week later, 3:30, summer day. Beautiful place. In fact, it's the same one. Still no students, no children playing there. Why? And I asked them, it's not safe to be there. My parents won't allow me. The community isn't shut down. This is Toronto that we live in. So until we can look at community health, you put somebody in this community, what are the chances of them living to their full potential in life? What is the chances when the parents are afraid to put them out, the children know where it's safe and where not too safe? How can they go to school and learn? How can they grow? What opportunities will be available to them? And why are we not closing the gap? Zero gun violence is possible. We already have the characteristics. We already know what it takes. Where is the will and the leadership to close that gap so that this grade 4 student has a fighting chance to live a full life? Health is not only for some. In the city of Toronto, good health from the city of Toronto, the gracious city that the resourceful city that we are, must not only be for some and not for the others. So zero gun violence movement is about closing that gap, bringing a different awareness and education about gun violence, not the root causes, the seed causes, because we know where it starts, even before the roots. It's about advocacy, that's why we're here, and it's about engaging the people that are victims of the violence and the people that perpetuate the violence, and that gives us a unique perspective of what's going on the streets. Community violence is a big problem in some communities, not in all. And until we classify that as a public health issue, we will only look at it as a criminal activity. Okay?
Thank you, Louis. You have a question, Trustee Glover. Oh, no, we're good. Okay.
Any questions?
Looks like we're good. Thanks, Louis. Thanks for your good work. Okay. Brenda McIntyre is next. Brenda McIntyre. Ah, there you are.
I don't know which way.
Yeah, just put it on as if we're...
A little bit brighter. Hold on.
We also have a techie guy that can adjust it. There we go.
Bonjour, Mishka Kinagaman and Equine Edition Cosco Kokodem, Toronto Dinjiba, Kamloops Dinjiba. Just saying greetings in the Ojibwe language, that my spirit name is Medicine Songwoman. I'm Owl Clan. I come from Kamloops, British Columbia, and I live here in Toronto. That's my son. I forgot to bring his picture because I have such bad PTSD that my memory lasts for a few seconds now. My son, Quinn Taylor, who was murdered along with another man who was murdered the same night. 5 people were shot downtown Toronto on January 31st, 2016. Since then, I run my own business. I help women find their voice. That's what I do. That's my passion, and that's my income, which I completely lost for the last, basically, ever since. I've had to go on disability because I have incredible chronic pain that stops me from doing most of the things that I used to do, including working. So my work life now is about 1/3 to 1/4 of what it used to be, and the rest of the days are now taken up with medical appointments, going to Anishinaabe Health to try and get my physical health back because of all this pain, and seeing the grief counselor that I actually now have to get a new one. I can't even see my best friend anymore when I want to. Why? Because her children grew up with my son, and her sons considered, well, all of them even, her daughter considered considered Quinn their cousin. They were so close. It is so devastating, not even just to me, but to them, that I can't even go visit my friend. There's a stigma that gets attached now to me, because it's like death walks with me. That's to bring that up in a conversation where most people are talking about, you know, oh, how are your kids doing? Oh, how many kids do you have? And the answer to that question has to be, I have one here and I have one in the spirit world. He was murdered violently 2 years ago. That's not a conversation I want to have. That's not a conversation I wish on anyone. This has affected my health, my memory, I have PTSD and all of the, chronic pain. But when I look around and broaden the scope, I mean, I'm a single mother. And like one of the speakers was talking about earlier, being a parent to my daughter after my son has just been brutally murdered, there's nothing but shock. There's just nothing but shock. Can do nothing. And I mean, without the supports, I've had to call on, thankfully, I know to call on supports, and this is a problem too. For myself, I can say that I have support because I happen to have a good community of friends, and I do not have family support, and I haven't, because I live here and my parents died a long time ago. But for people who, you have to be an advocate for yourself in ways you would never even think possible. And in the moments when you have no strength at all and nothing left, my whole life has been broken apart. The friends of my sons, their lives are still broken apart. In fact, some of them are actually in jail who have nothing to do with this. And I know that. But the police are keeping them there, probably for questioning, for trying to find out who actually did it. They have 2 men in custody. My life has become medical appointments and court. Standing up for my son who cannot anymore stand up for himself, and his little girl is left with a single parent as well. When all he wanted was to raise his child and be a good father and to do his music. And his friend that he was out with when they were just celebrating their friend's birthday is also no longer here. And his daughter is also alone with a single mother. Like, I can't even describe the impact this has on not just me, but my family. Then it goes out to, my daughter's friends, their families. Like, if you can imagine, and you probably can't unless you're Chris Glover or someone else who knows, if you know someone who has been murdered, it's a life-changing thing. I've just had conversations with people at business conferences where I'm supposed to be going there to speak about my business or to share about how to help women find their voice. When I disclose what's happened to me, there's nothing but shock right in front of me. And so I have to carry that around for the rest of my life, and I just walk around, and that's who I am now. I'm the mother of Quinn Taylor, and it's almost like, and I wonder about this sometimes, my daughter, it's almost, that parenting thing. I mean, I have pictures of my son all over in my bedroom. Do I have pictures of my daughter in there? No, because she's still with me. And that's kind of weird, isn't it? And so it's all of this confusion and frustration, and for me, it's been very difficult to find organizations to support me in the way I need supporting. And this is one of the problems too, is we have resources. Toronto is a very resourceful city, and but finding those resources sometimes is impossible because, for example, one of the counseling things that was so amazing for me was through the Toronto Distress Center, but nobody knows about them because they don't have enough funding to get themselves out there. And I had to search for months, actually, to find them because I knew there was going to be something, but grief counseling can't cut it if people don't understand what it's like to lose someone by murder. It's affecting everybody I know, even if they didn't know my son. And I really hope and pray that the City of Toronto and, bringing this in as a determinant of health can start to change things, because I know that's what my son would have wanted.
Thank you very much. Once again, Brenda, we share your grief. I don't see any questions, so I invite you to take your chair. And again, thank you very much for your presentation. Next, we have Katie McDevitt, sorry. Welcome, Katie.
Thank you. Good afternoon, everybody. I thank you for giving me the chance to speak to you today. My name is Katie McDevitt, and I'm here to ask all of you to support Trustee Glover's motion. And I'm here to speak a little bit to the ripple effect that community violence has. Both Evelyn and Brenda have referred to that. What I can tell you is that when you hear about gun violence, about people being shot and wounded or people being shot and killed, there are more people being affected, really deeply affected, than you might think. And I'm one of those people. More importantly, my son Nate is one of those people. If you've got kids, you know that parenting is not for the faint of heart. It throws you all sorts of challenges. You kind of know we're going to come down the pike, you know to expect, but it also throws challenges that you never anticipated. On a beautiful spring evening, April 13th, 2016, a young man called Gabriel Nikov was killed by a stranger with a gun on a busy street in downtown Toronto. Gabriel was 18 years old at the time, and he was well known to me and my family. He'd been one of my son's best friends through elementary and middle school, and he'd spent what felt like a million hours playing at my house in Kensington Market, down the lane, horsing around, laughing this great big laugh that he had. And the parenting challenge I mentioned, that was when I had to look into the disbelieving eyes of my tall son and try to comfort him in the wake of Gabriel's completely senseless death. What can you say or do as a parent to ease your child's pain in the face of such an ugly loss? What? Honestly, there is nothing. There is no comfort that you can offer your child in that circumstance. And that's horrible. I mean, that is really, truly horrible, and it's painful, and it's, above all, it's unhealthy. I can feel my heart race every time I think back to that moment of trying and failing to offer some comfort to my kid. I can feel it racing right now, just telling you guys about it. I'm reminded of how much anger and anxiety and grief and this perpetual feeling of helplessness can have an absolutely deleterious effect on health, on physical health. I think about how cortisol, which gets released when we're under stress, it's been described by psychology today as public health enemy #1. And believe me, the stress you experience, even as someone removed, not one of these moms, but someone more removed from this kind of violence, the stress you experience, it's off the charts. And there's more to it than that. Nearly 2 years after Gabe's murder, my son, now 20, is still struggling psychologically and emotionally. And he's my hero, my kid, because he is fighting hard against all that grief and all that anxiety and all that anger. But man, they are hot and fiery, those feelings. I mean, you know, think about it. Why wouldn't they be? And they are difficult to work through. Even when you get counseling, which my son has absolutely done, talked to a psychologist, talked to a social worker, he's doing all the things that he should be doing. Still tough making inroads. And believe me when I tell you that my son is far from alone in this struggling. Gabriel had many, many friends and acquaintances. Honestly, that kid, he was a social butterfly. And this city is full of people who knew him, who cared about him, who loved to hang out with him, and who now are bereft without him and fighting these really dark demons. And you know, people in extremis don't always make really wise choices for themselves. We all know that to be true. People who've suffered grievous trauma might try to self-medicate, you know, numb themselves, using and abusing alcohol just to forget, to get through the day. Some people become isolated and withdrawn. Some become fearful and trusting. Some become angry and lash out. And they hurt themselves lashing out, and they hurt other people lashing out. Many people contend with PTSD. And none of this helps the common good. And in my opinion, absolutely all of it is a public health issue. There are certainly people who have endured enormous psychological travails that will overcome, but there are those that won't. Unsupported, they will not. Each one of the kids who knew Gabriel is unquestionably marked forever by his death, by his murder. And some of those kids, I honestly fear, will prove to be permanently damaged. For young people especially, when their brains are still developing and they're just beginning to navigate their way into adulthood and the wider world, losing someone in this violent way, losing someone to gun violence, it jeopardizes their health and well-being, and not just in the immediate aftermath, but in the long term. This all adds up to the fact that guns are a public health problem. If this board is engaged in making policy to support and further the health and well-being of Torontonians, it'll surely recognize that gun violence, with all its far-reaching after effects, is an issue it has to take on. Is it in the public interest for our young people to grow into some kind of healthy, functional adulthood? Of course it is. So to that end, I'm going to ask you to vote in favor of Trustee Glover's motion. And the last thing I want to say, and I really do want to say this, is Gabriel deserved so much better than what he got. The other kids who are left behind, they deserve better than what Gabriel got. We all do. That's what I got to say.
Thank you very much, Katie. We appreciate you coming in. Our next deputant is Kelly Wetter, Communities for Zero Violence. Kelly, nice to see you again. And welcome.
This is Gabriel Nikov that Katie was speaking about, and he's missed by a lot of people. I'm still in shock. It's not quite 2 years that he was killed. And yes, my doctor has diagnosed me with PTSD, anxiety. I do work a little bit. I have to work. I'm not going to take the 5 minutes because it's too much, but I support Chris Glover 100% with this proposal that he has. Thank you.
Thank you. Is it okay if we ask you questions, just in case there are any? Is that your son? That's your son, right?
This is my son, Gabriel. Yeah. He was 18. And he had a 13-second altercation at Yonge and Bloor. It was still light out, tons of people. It was about 5 to 8. And he turned to walk away, and this young person pulled his gun out of his backpack. He was 22. And shot my son in the back 5 times and once in the left arm. And he just died right there on the pavement. And I had just seen him 4 hours before. But they did catch the guy that murdered him, and he doesn't come from a very good place. His parents won't be at the trial. The detectives tell me that the parents gave him to Children's Aid when he was 14. I don't know what neighborhood he lives in and where he got his gun. It was never retrieved from the murder. It might show up in another murder. But yeah, so the stress and anxiety that I'm going to be going through for the trial in May is going to be off the charts too. So that's where some medication might come in, because through the pre-trial I was nauseated the whole time. It's just too difficult to look at the person that killed my son.
Thank you.
Yeah. Thank you.
Appreciate this, Kelly, and we too are with you as well in your grief.
Thank
you. Next is Zia Brown, and I understand, Zia, you wish to depute with Denise Dye, Fanfari Fraser, and Taryn O'Neill. If all of you want to come forward, that would be great. I think there's enough chairs there.
Good afternoon. I am here to support the proposal by Chris Glover that gun violence is a public health issue. I'm the founder of an organization called Think Twice. I'm not sure if we are able to get it up on the screen. You guys have full copies?
How about you put it up on that screen right there?
Actually, I believe.
No, let me grab one.
We've got them all, but if you want to put it on. Hold your time.
So Think Twice is a grassroots organization. We are based in Rexdale, the Rexdale community. We provide non-traditional, culturally sensitive programming and supports to youth from at-risk communities and also young people who are incarcerated with a priority to federal institutions. We're in a handful of federal institutions. I started this program for a few reasons, and because I don't want to go off topic, I'm just going to read you what I wrote. The purpose of this program was to initially give hope to the hopeless. It was also to provide coping strategies for young people who have unresolved grief or trauma. It was to build positive male role models in at-risk communities that youth who are at risk or gang involved could identify with. And also to provide supports for people that may not have any supports. I want to touch on a few of those issues in response to Chris's motion. One of the things we do is provide theater programs that incorporate story sharing, incorporate music, as a coping strategy for grief and trauma. So the communities that we come from, at-risk communities, there are many young people, as you've heard from the stories, there are many young people who have unresolved grief and trauma. Not only on a personal level from these communities, but also intergenerational trauma. So a lot of these young people that we work with, and my son, I'll give an example. My son, I started Think Twice with my son in mind. My son was 12, 13 when 2005, and 2005 is the year I changed my life, and I changed my life due to the gun violence in the community. So we had funeral after funeral, young person after young person in the family or close family friend who was killed by gun violence. There was no culturally sensitive programming for my son, and a lot of the young boys ended up smoking weed or eventually taking other drugs. My son didn't take any other drugs. But at the end of the day, a lot of people medicate themselves with alcohol, with weed, with drugs, because they're trying to take the pain away. Other times people turn to criminal activity, turn to gang violence, turn to gun violence because they're looking for supports, because they're looking for protection, because they're hurting. So I definitely agree with Chris in that this issue is a public health issue. We definitely need to have programming that and supports that touch on symptoms of post-traumatic stress disorder, trauma, unresolved grief, however, it has to be in a culturally sensitive way. And when I say culturally sensitive, I mean culturally as in cultural, race, cultural as in youth focus, cultural as in an understanding of the streets or understanding of high-risk neighborhoods. So those three things must be taken into account when we focus on culturally sensitive programming. So Think Twice is a program that offers a few programming. One of them I said was, as I mentioned, was a theater program that we offer for Black History Month in the federal prisons. And then another program that I wanted to touch on quickly was a Kings to Kings program. It's called Kings to Kings, and that's where we bring young people from the community into the prisons, and they are involved in a series of workshops. Now, those workshops they're in the community and also in the prisons. In the community involve young people who have been in prison and have now reintegrated back into the community. They are part of this program where they facilitate workshops. We also have workshops in the prisons where young people share their story to these youth that are coming into the prisons as a form of prevention, so gang prevention, violence prevention. We build mentors within the prisons so that they can become positive leaders. So to me, it's very important that we touch on building positive male role models who youth can identify with, and that we also touch on trauma, coping strategies, culturally sensitive programming in every aspect in order for us to be able to address this issue of gun violence and also gang violence, which is now very prevalent in at-risk communities in Toronto. And we have some youth, the young person that spoke before, his name was Jason. He's a young man that was in our program, our Think Twice program in the prison. And he came out and he's now volunteering and speaking to youth. And then we'll have a few of the youth speak as well.
Okay.
So just talk about when you started.
So you must be Taryn?
Tevin, yeah. So my name's Tevin. I started Think Twice at the age of 12. And the reason why I started is because I have sickle cell. I don't know if you guys know what that is, but yeah, it's a illness. And my brother and sister, they didn't have it, so my mom was more protective on me, so I didn't really have no one to play with, so I was a little aggressive, rough around the edges. So going to school, I was aggressive, and Zia started a program where when I was going through the program, I learned how to cope, how to deal with anger, and that program it impacted my life. And through that, I grew from a student there to a leader where I'm mentoring others, I'm teaching others how to get jobs. That program helped me a lot, so I just want to say that. Yeah.
Great, thank you very much, Kevin.
Started at the age of 12.
You work with 8 to 12-year-olds?
Pardon? I started at the age of 12 and I'm 25.
Okay. And what's the demographic of your age group? How old are they, the folks that you work with?
We work with ages from 11 to 29.
Okay. Full adults.
So we work with youth between the ages of 12 up to 39. We have different groups, so depending on the group, that age group.
Fanfari?
Can I touch about that picture?
Sure, yeah.
And if you look at that picture, that's us going into the jail. The prison, sorry. The people in the blue is the inmates, and the ones not in the blue is us. So we do programs with them, and yeah.
Fanfari?
I just want to touch on that real quick. The reason why this is so important is because there are no culturally sensitive programming in the federal institutions. So in order for rehabilitation to take place, people need to understand the issues that we face. And as I said, non-traditional culturally sensitive is the way that what we focus on, both inside and outside as well.
So it's John Fari.
You pronounce it correct the first time, it's Jafari. You can say Jafari, but my mom named me Jafari. It's pretty ethnic, I know. Okay. Greetings, chair members and members of the committee, and my fellow public as well. I am Jafari Fraser. I am 21 years old. I am a current student at Humber taking paralegal. I am a testimony and a product of my community. In 2001, when I was 5 years old, my brother was murdered. In 2016, when I was 20, my friend who looked to me as an older brother was murdered during that time. During that time, Zia suggested that I should join her Think Twice program called Kings to Kings, and I very frequently declined the offer. It wasn't until the following year when I decided to give the program a chance, I went on as a participant. Before my visits to several federal institutions with Think Twice, I grew up with the thought that bad people go to jail, and if you do the crime, you do the time. However, during my visit, all these notions started to dwindle, and I began to realize that although these men have been indicted and convicted, that they are still fathers, they are still sons, they are still brothers, cousins, male leaders, and role models to a community that desperately needs them. I have witnessed the increase of gun violence within my community alone, and every week I get phone calls of this person dying and that person dying like it is a checklist. The issues has gone so bad that youth are becoming desensitized. Nowadays, you don't even have to be gang affiliated to be targeted. And the number of attendees at these funerals are more youth, young people, than they are adults. The youth are crying out for help, and they want and hunger for a change. When you look into the eyes of any youth that is convicted or not, you can tell that they are broken. I now sit as a junior rep of Think Twice of the Kings to Kings program that was created for Toronto by a mother of Rexdale, Zia Brown. I could have picked up a gun and I could have retaliated during the time both my brother and both my cousin or my friend have died. However, this program and the males that I've been introduced to this program helped me gain older brothers and strong male role models, whether they are within the prisons or in the community. This is my motivation. This program itself is my motivation that when school gets tough, there are people within my community that need me to get my BA in law, go to law school, and need me to be called to the bar, and I refuse to let another brother die in vain. Thank you.
Thank you very much. I'll invite Denise to say a few words as well.
Thank you. Good afternoon, everyone. My name's Denise Dye. I'm a recent member of Think Twice. I'm a silent co-chair member. I come from a quality improvement and accreditation position in correctional service, health services department. And with that QI mentality, I'm always looking to make things better. But I look to do it in the most efficient and common sense way possible. I'm here to support Trustee Chris Glover's motion to make gun violence a health issue. As you've seen all the other speakers speak to. But I also want to show that it can be done in a more cost-effective and common sense way. We have Think Twice. Sometimes we don't see what's already under our noses, and Think Twice basically mirrors what the Interrupters program is doing in Chicago. I think it would be an amazing opportunity to combine the two programs, get some additional feedback from the Interrupters, but we can't deny how successful Think Twice has been. They've been operating since 2006. This program has actually been court-ordered to youth as a deterrent and a rehabilitative program. I urge you to first look at Think Twice before starting a whole new program from the ground up. Think of the cost savings alone. But most importantly, utilizing Think Twice has the added benefits of having locals speak to locals. Only they know what they are facing in their own communities, giving our youth hope and skills they need to thrive, giving our incarcerated and newly released members way to give back to the community and transferable employable skills and reasons to work towards rehabilitation, and keeping our funds in our community.
Are there any questions?
I'm just waiting for Denise to, and then we'll ask questions. You got a few more minutes, Denise. So.
Okay. Of course, Think Twice, with joining with the Interrupters program, would gain useful insight and beneficial complement and techniques from them. It would all be an add-on and a fraction of the cost of starting from scratch when this program is up and running and going. A lot of the training could be web-based. That can be facilitated in the prisons with the men in there that are the mentors already working with Think Twice, with the youth that are coming in. And when you are training the young men inside to become leaders and mentors, you're gonna get so much more back than somebody then you're gonna recruit off the street or out of university. When you invest in them, show them that you respect what they've been through, their experiences and their lives, and that you want to help them rehabilitate, you will get so much more back than any amount of money will ever pay for. And that's pretty much all I wanted to say. I wanted to add.
Great, thank you to each of you. Are there any questions of any of these four, seeing that they came as a group? Councillor Doucette.
Thank you very much for coming. We've got your package, but unfortunately we only had it in black and white. So I wondered if you could put your colour copy up of the Toronto Major Crime Indicators for 2014. It's a little hard to identify the colours.
You just passed it.
Is that the bar graph? Oh, no, the map.
Just so we can see. I'm just trying to compare your numbers. I represent 11th Division, so I was trying to connect your numbers to there. Okay. I appreciate you going to prisons. I think that's fantastic. The people you work with when they're in prison, when they come out, are you just putting them back into their communities, or are you putting them into communities where there's the need for someone to come and talk to the youth and say, listen, this is where I went, but we want to help you not go there?
That's what we're trying to build right now. We're trying to build leaders in the community where they can reach out to wherever the need is.
Okay.
Whether it be their community, whether it be outside of their community. Sometimes they have stipulations if they are on parole. Mm-hmm. However, we are trying to build it. We do have a lack of supports, I'll be honest with you. If we did have those supports, we would definitely have them reaching out beyond the community into other communities as well. I think that everyone can benefit. I know that the issues are, the need is so high in regards to speakers who have lived experience, prevention, intervention.
And how would a community know if there's someone from their community in your program? How would we connect?
How would a community?
So, for instance, in my community, if my community wanted to find out if you had someone from our neighborhood in your program, how would we find that out to encourage them to come and speak to their neighborhood?
So that would be done through Think Twice. So Think Twice has all of our speakers, all the bios. You can, on the website, you can look and see who, well, we'd like to have them on the website and see who you'd like to choose.
Okay.
Right. So even pairing with youth, with young people that are inside, we have to do that same strategy as well, depending on charges, depending on neighborhood, similarities. People who have lost their sons or their brothers, or so there's a lot of coordination that comes with it. But yes, Think Twice is definitely involved in it.
Okay, thank you.
It's a question for Jafar, but anybody could answer it. Jafar, you've lost 2 people to gun violence.
Correct.
And you haven't retaliated. And one of the things that I came across when I was reading about this was that in order to, somebody, and I guess the question is, somebody had to have had the credibility to tell you not to, or convince you not to retaliate. What is that credibility? And I'll start with that, yeah. So,
sorry, could you break down the question one more time?
So what is the, like, somebody convinced you, and it may have been Zia or maybe been somebody else in the program, but somebody convinced you not to retaliate. What is it about that person that made you listen to them? How come, yeah.
Can I touch on that real quick? Not everyone that has faced a loss wants to retaliate. Mm-hmm. It's dependent on what's in their ears. So if you have 10 of your friends, your support system that's in your ears telling you to retaliate, chances are you're going to retaliate even if you don't want to. But if you have a positive support system that is, whether it be faith, whether it be whatever that positivity looks like, that's when you're, Or it could even be someone telling you to share your story, that there's purpose to your pain. That's when you'll most likely go the next way. Now, unless it's in you to want to retaliate, and that's where the unlearning of behaviors or the post-traumatic stress disorder programming and the coping strategies come in, where you will learn how to release that pain. But sorry, you can answer that.
And to back up what she said, his mom, for my friend that was murdered 2 years ago, his mom actually spoke to a whole bunch of us. She just gathered the youth together. She said that she doesn't want nobody to retaliate. She wants this to be in God's hands. And with that respect, because she was so closely related to us and because we knew her and what type of woman, which is a Christian woman, a strong Christian woman that she is, we respected her opinion and we decided, yo, we cannot do this. What justice is going to be served if we retaliate? All that's going to cause is a bigger problem within the community and other communities as well.
Thank you very much.
No problem.
Thank you. Brilliant answer.
I want to.
Oh, sorry. Yeah, you.
I want to also add to that. So, like for me, once again, I was troubled. So, I learned coping skills through learning the truth. Like, I'm very family orientated now. So, like, I remember saying like, you do this and then you go to jail and then who's gonna look up to me? So like, that really spoke to me. It's like, it really meant to me because even when I told my dad, like, I said the same, I quoted her. I'm like, you're smoking, you're gonna kill yourself. And I know smoking's a hard addiction, and he realized that he wanted to see me graduate, and he stopped smoking, and I graduated from Sheridan, and he said that was the happiest day of his life. So yeah.
Okay, thank you to the four of you for your very insightful presentation, and thank you for the good work that you do as well.
Thank you.
We have one more deputant, and that's Elizabeth Correa. Correa, my apologies, Elizabeth. Correa. Thank you, Elizabeth, for coming. Is there a red light there on? Is it on now?
All good now? All right.
Yeah, we're all good now.
All right, well, thank you for having me. Last but not least, I guess, I am here. I'm the founder of a company called the Diva New Group, which is a self-development and leadership company for youth. And I'm here in support of Trustee Chris Glover's motion. So I'll share a little bit about my story. I know we don't have much time, and what I do today and why I'm in support of this motion. So I grew up in Regent Park in government housing. I was born and raised there. All I knew was violence. I was born into violence as a child. I didn't know any different. So that for me was, that was the norm for me. Drugs, prostitution, guns, homelessness, you name it. Both my parents were severe alcoholics and extremely abusive, physically, emotionally, mentally, and my father was also sexually abusive. And that abuse started as far back as I can remember, 4 or 5, maybe younger, I don't know. And although I was raised with both my parents, the violence I witnessed between my parents painfully affected my childhood. And by the age of 14, I became a product of that environment. I started selling drugs, guns, going on armed robberies, and I found myself in a cycle of violence. My life has definitely not been as glamorous as I look. So within a few months, 3 months, actually, a whole bunch of things happened. It was like a domino effect. My father went to jail. My siblings and I were all separated and put into foster care. I was 14. My brother went to jail. And within the first 6 months, I lived in and out of 10, 15 homes. So I lived out of a garbage bag. And, you know, only God knows what I saw in those 6 months and what I witnessed and what I got into. because of the pain, the silent pain that I was dealing with. Between 14 and 26, my life was filled with anger, violence, guns, losses. At 22, my boyfriend at the time was murdered in front of me and died in my arms. And I dealt with that pain and that trauma and that grief alone with my 4-year-old son. And it was very painful, very painful. It was a turning point in my life, yes. It was kind of the wake-up call, I think, that many of us, including Zia, who I've known for many years, we grew up together, and I know where she's coming from and what she's built, and I'm super, super proud of her. I just wanted to put that out there. But it was a turning point in my life. But at the same time, it took another 5 to 6 years to wake up and to get out. The depression and fear that I was living in caused me to make some very toxic choices before I left. By the time I was 22, I had been to over 22 funerals. 95% of the guys that I grew up with are dead or doing life in prison. Some of them have just recently come out or, returned home after 20, 25 years. But there was this sense of love that I was addicted to on the streets. Although it was painful and it was scary and unsafe, not safe at all, I felt safe in a very twisted kind of way. The love and the loyalty that I feel like I had on the streets was total opposite of what I had at home. And so I got addicted to this kind of love. And the way my street friends loved me was, giving me a gun to protect myself. And putting some drugs in my pocket to sell, to have money. I had no parents. I was, mom, dad, gone, siblings. I was out in this world alone. And, they became my family. And I, too, in return, gave some friends drugs to sell, to have money in their pocket, or a gun to keep them safe. And it was my way, my twisted way of showing my love for them, and their twisted way of showing their love to me. But did we even know what love was? Because I didn't. And I know today that they didn't either. It wasn't until my friends all started to die and go to jail, or like I said, they were gone for forever. Oh, Richard's gone and he's not coming back home, or he killed somebody. And it wasn't until this started happening back to back to back to back that I had to make a choice between life and death. And death was something that I saw a lot. And I survived it. But it got to a point where I knew I had to get out. And when I look back on those years of my life, and obviously I did get out, and I'm giving back and serving my community and communities around the world as a speaker and a mentor today, and I've dedicated my life, my time, my energy, my blood to doing this. And when I look back on those years of my life, and I look at the youth that I work with today, there's one thing that hasn't changed. Their need for love and support. A safe space with mentors. A place to unlearn what they've learned about love, loyalty, and community. A place where they have access to role models and programs that provide prevention, intervention, and rehabilitation. All three. We see the intervention. We're not seeing much of the prevention. And the rehabilitation we're definitely lacking in. Places and programs where we can love our youth back to life, just as my mentors did for me. My mentors were survivors. My mentors spoke the same language as I did. They had lost people. They were caught up in gun violence, in the street life. They were survivors. And they were serving and making a difference with their stories. And it wasn't until I met some of these people that I really started to crave this change and to live. Prior to that, I don't think I really cared to live. I was just, you know, being busy trying to stay alive, that it was, I didn't think, okay, well, I want to live till I'm 30 or 40. I'm in my 40s today, but I don't think I, you know, thought that I'd make it to my 40s, to be honest. When, I believe it was Paul, is it Paul, who asked, I can't remember if it was Paul or if it was Chair who asked, where does violence come from? I think it was, was it you, Joe?
One of us did.
Okay, I think it was you. Where does violence come from? I sat there and I thought to myself, well, my whole life was violence. You know, my parents, it's all I knew. And I thought back, well, where did that come from? Where did the violence, before I took up guns, you know, before I started, you know, I was attracted to bad boys, gangsters. Where did all this come from? You know, why did my dad sexually abuse me? And where did that come from? And I kind of went backwards and I thought, well, I came up with 5 things. Number 1, poverty. That I know for sure. And we lived in that. We lived in poverty. Depression, mental health, and pressure at home, in the family. You know, my mom didn't work. My father brought in, you know, all the money and the pressure of raising 4 kids. My father was also blind at birth. He's a blind man. And so he had to provide and be, you know, the protector. And that took a toll on him. My father was also sexually abused as a little boy. So it kind of just, it's like this generational curse. And I believe a lot of it comes from poverty and depression, mental health. One of the things I believe would make a difference, and I know it was definitely someone on this side who asked, you know, where could you spend some of this money? Mike, I think it might have been you. You know, what can we do when we're revisiting this plan of action? What can we do? Where can we invest? And I don't know what this means or what you can do with this, but I do know that in the work that I do, I often hear every day. I mean, I've got partnerships with all school boards. I speak in 2, 3, 4 different high schools a week. I see what's out here. I know what's out here. But it's through my own business. And so there's some freedom to share certain stories and do, you know, talk about certain things where teachers and certain social workers can't, or they don't really have workers and youth workers who have lived it and survived it and been there because, well, they've got a criminal record, so they can't get these kind of jobs. So one of the things that I would suggest, and I would like to see, definitely more of Think Twice. That is an incredible program that I don't see anywhere, especially in the prisons. But one of the other things is to see some of our survivors. Yes, some of these men and women who may have charges, you know, and they've got a criminal record, but they've now dedicated their life and their time to giving back to their communities, to building programs and workshops. Thankfully, okay, I don't have a record. All the trouble I got into was under 18, nothing stuck with me. But that's me. But I know a lot of other amazing people who are serving their communities and can only do so on this tiny little level because they can't go and get that job as a youth worker, as a community activist for a non-for-profit, whatever it is. It's enabling, their record is enabling them from doing more, being mentors to these youth. One of the things I often hear, like I was saying, and then I kind of went off it in schools, is, Miss, you made a difference in my life because you understand me. I listened to you because you've been there, done that. You survived. You got out. So that means I can get out. I hear that almost every day. So I would like to see more survivors and mentors, people who have lived it, been there. Some of these guys coming out of prison, you know, getting into the schools, talking, youth workers, social workers. I don't know what you can do with this information, but I promise you this. I would be dead if it was not for those mentors in my life.
Thank you very much, Elizabeth. Appreciate you telling your story. Any questions? Thanks again.
Thank you.
Are we ready for questions? Now's the time for questions of staff. I'm not sure if people want to take a little break or just go on, continue. Okay. Questions of staff. Councillor Doucette.
I know there's many, but I'm just going to ask this one for now. We heard from some of the mothers speaking and some of the friends who've lost, whether it's relatives or friends of, that they find it very hard to find a support group to get them, to help them, to keep them alive so that they can continue being a mother or a friend to someone else. What services are out there and why is it so hard to find them?
So through the chair, thank you, Councillor Doucette, for the question. So before I answer, I would like to again acknowledge, you know, the courage and the strength of those who came forward and told their story. And thank you very much for taking that time and for sharing those important stories with us. And we do hear, and we've had some opportunity, at least I've had some opportunity to speak with some of those who presented today prior to today's meeting to understand the circumstances. A couple of things just to provide a little bit of context. The first of which is that these are very, very complex social issues that we're talking about here, right? We've heard from many who've deputed here today about the significance of such issues as poverty and an increasing disparity between haves and have-nots and an us and them sort of context. And these are not issues that are resolved with, you know, the actions of one division or one department within a city. This is a very, very complex set of issues. Speaking to the lack of service, as described by many who've come here and deputed, you know, again, within the context of public health, that's not something that we're particularly active in. When we talk about counseling and mental health services, we tend to defer those things to our colleagues within the healthcare system who frankly have more expertise in dealing with those issues. That being said, we're happy to collaborate with our partners throughout the city and with partners in healthcare to try to draw attention to the issue and to highlight the impact in particular of the exposure to community violence, not only on those who are directly impacted by that violence, but on the surrounding community. We do have representatives here who very kindly joined us from our Social Development, Finance and Administration Division. They have a number of programs that are actually meant to even be, along with public health, pretty upstream in terms of trying to create the conditions that, you know, get at some of the items that many of our deputants have spoken to. The need for inclusion, creating communities where people do feel safe. These are the kinds of things that we really need to do. And again, I'll remind you that from a public health perspective, we are extremely upstream. So our notion is to not just prevent gun violence from happening, but to actually create the conditions very, very far upstream, early in life, so that children, families feel that they have a place that's safe, where they belong, so that they're not brought into gun violence. And I think many of the materials that have been distributed, whether it's from Think Twice or the other groups and folks who've deputed so far today, speak to that need to be upstream.
But I will defer to my colleagues at SDF&A if they would like to comment on the kinds of work that they do, both in the aftermath of violent episodes in the community and as well upstream.
Just before you speak, we're going to have a quorum problem in 7 minutes. So we are having a, if we want to do this, we're going to have a Twitter-sized question period and Twitter-sized speaking period. Otherwise, we lose quorum. SDFA, having said that.
Thank you. Well, first of all, I would like to thank everyone for their honesty and their courage for coming and speaking today. And thank you for Trustee Glover for putting the motion forward. Those of you who know me, this is something I've been passionate about for a long time, so I think it's very important that it's come forward today. My name is Scott McKean, and I manage the Community Safety and Wellbeing Unit here at the City of Toronto. One of the programs that I oversee is the Community Crisis Response Program that responds to violent traumatic incidents, and we work across the city. I have 4 staff for the city that try to connect people to support services, aftermath, work with Victim Services Toronto and other organizations to help facilitate that healing. I think that, given the time constraints, what I would say is I've taken note of what everyone has brought forward to today, and I'd like to connect with those of you who did experience or speak about the gaps in service in terms of victim support services, because there's municipally sort of driven coordination for supports, and then there's provincially funded victim support services. And if there's a disconnect there, I'd like to speak with you directly about that to see how we can best support. There are support services out there, and so as a follow-up from today, we can post those sort of victim services and support services online, but I'm going to connect directly with you afterwards, after the meeting today.
Thank you very much.
We can have a conversation.
Are there any other questions? Okay. Okay. Press your mic too.
Sorry, thank you. We've heard from Zia and Elizabeth the need for people from the community who have the credibility to actually speak with the youth in that community, who understand where they're coming from. Is that part of the recruitment strategy? And Elizabeth was talking about, people with a criminal record have trouble getting jobs as social workers, or going into schools. Is there a screening process? Is there a way of recruiting people who have a record, and who have experience and the credibility to actually work in those communities? Is that part of your program?
So through the chair, there was a report through the Community Development Recreation Committee about recruiting people with criminal reference checks last year. Then it's totally part of our programming here at the city. For our program specifically, we invest in, Social Development Finance Administration Division invests in community-based program, the Think Twice program being one of many of those initiatives. And I think what's important to learn from the amazing work that Zia and her group are doing, there are others like Zia across the city, and I think we need to bring those folks together to coordinate with city services to do that. So the answer is yes, that is part of the work that the city is doing.
Okay, thank you.
Thank you. Speakers, I know Councillor Shan has some words to say. I'm going to ask him to be very brief.
Thank you, Trustee Glover, for bringing it. Thank you to all the deputants. And it's hard to sometimes relive the pain and so on, but for the good of the community, you're here to share so that we can have social change. I'm very supportive of this motion, but I also wanted to kind of make sure that I put the cautionary note, because access to educational opportunity is a social determinant of health. Access to employment is a social determinant of health. Access to housing is a social determinant. It's already accepted in many ways, and sometimes just naming it is not enough. I think the most important part comes after that. The other caution I want to make is that we used to call things youth violence before, and we moved away from it before. We were tagging young people for the violence that is societal, and the community violence also needs to be qualified and understood properly and defined well, so that the communities don't get stereotyped and profiled as a result of what we consider something. So it's very important to have that. One other thing I want to finish off by saying is that, it's important for us as a city to work with small organizations. Sometimes big institutions shy away from working with smaller organizations, but they are the ones who have the grassroots connections and the ability. So Think Twice, Zero Gun Violence have a lot of resilience and the connectivity. Sometimes the bigger organizations that get a lot of money don't. So we might need to use this as an opportunity to revisit how we spend dollars and where we spend dollars so that we can be more effective. Thank you.
Thank you. Anybody else? Councillor Doucette?
I'll be very quick. I want to thank everyone who's come out today. As a parent, I have a 22 and a 27-year-old, and I'll tell you, when they're out downtown or out on the town doing, with their friends, and you hear about a shooting, your heart skips that beat. So my condolences to each and every one of you. I know from my community that when there's a shooting, it's not just the person who has either been shot or if there's a stabbing, it is the whole community. Children stop going out to play. We've seen that. Mothers walk their children to the subway or to the TTC stop because they don't want them to do that on their own. 20-year-old full-grown men are being escorted by little mum to the TTC. People don't come out of their homes. In my community, we had a targeted shooting at a community barbecue. They didn't have another barbecue for 4 years, but the community came back and took back their community. I also know it doesn't just affect the community, it affects the kids in the school, the brothers, the sisters. I have actually contacted principals saying, are you aware of what happened to this family at this point because you have their siblings in your school? Usually our police are good, and usually if it is in a TCHC, they also reach out to the schools. So yes, I most obviously do support this. As I say, it does go beyond the immediate family. But one question I also wanted to ask one of the gentlemen was, when I was on parent council, we lost hall monitors in our schools, in our secondary schools. And we knew that our hall monitors had their ears to the ground and knew the youth. And we knew that our hall monitors were able to find out who was selling drugs, who was bringing guns in, where the rumble was going to be, what was going on. And I fought tooth and nail then to the province to get hall monitors back. We got half a hall monitor. So I do believe the province has to step up to the plate as well and bring that trusted adult back into our schools so our children, while they're in school, have a friendly face they can talk to. I have many, many more things to say, but I won't because I know we're going to lose quorum. But thank you for coming out today. We really value, I hate to say your opinion, your experiences, and this is what helps us as a city to improve how everyone lives. So thank you.
Thank you very much. I'll just speak for literally 1 minute. I also am extremely thankful for the courage that folks have shown. This is a bit of a weird forum, being so formalized in that, but you spoke with great pain and great determination and great conviction, and I think also with great wisdom. And I think we are frankly honored to have heard that pain and that wisdom, and I hope that it is part of your healing journey. We have done work here on this Board of Health on spousal violence, domestic violence, and we've tried to tackle that as an issue. This is taking the other side of it, like what is happening in our communities, and can we as public health, it's not something that historically we've done, can we make a contribution to this conversation? And I think we can. We do a lot of mapping in public health, and that map that someone showed of where the gun violence, where the community violence is happening, guess what? It's the same map as where poverty exists in our city. You know what? It's also the same map where we have food deserts of good vegetables and fruits and in supermarkets and banks and civic life are less present in those communities. It's also communities that don't have good public transit as well, some of the poor public transit. It's also the communities, as St. Michael's Urban Health team noted, is the highest rates of diabetes. So, to unlock this issue, there's a whole bunch of other things that we need to unlock as well. So it's not just about public health, it's not just about policing, it's about a whole bunch of things. And then you throw on top of that all the things that we feel about people who've offended us or offended society via the criminal justice system. Until we as human beings tackle that instinct for revenge and retaliation, we're not going to get to the place where we need to go. I think this is an excellent initiative, Trustee Glover. I applaud you for taking it on, and there is some reporting back that is being asked for. I know that I'm glad that SDFA is going to be part of it. This is the beginning of a conversation, and you know what? Be passionate. Keep us at it, and bit by bit, we'll try to do the change that I think you are asking us to do. Anybody else? Final comments? Okay, we'll take a vote on the motion. It's been slightly amended, just the wording changes that to distinguish community violence from domestic violence. Did you get that? Oh, yes. My apologies, I should have made this before. Okay. So we're putting the exposure to community violence as opposed to exposure, community violence.
Community exposure to violence.
Yes, and it has to be fixed there as well. Oh, sorry. I thought we were going to use the term exposure to community violence, which is in number 1 and in number 2.
Yes, number 2 needs to be fixed.
Number 1 and 2.
That's correct. It was just, yes. And are we putting the bucket part?
And then in brackets, it's going to be as distinguished from.
You've got it on your page over there. It's right there.
So we're going to, after the word violence, as distinguished from domestic violence, in brackets. Okay, with those changes, could we take a vote? All in favor, opposed, if any, that's carried. We are adjourned, and thank you once. Adopted as amended, all in favor, carried. We stand adjourned. Thank you very much, everyone.